Good day. Welcome to the World Health Organization Global Conference on Communicating Science During Health Emergencies. Today is the closing plenary discussion. My name is Melinda Frost, and I'm the Translate Science Team Lead for the Health Emergencies Program at the World Health Organization. Today represents the culmination of 3 very lively discussion weeks from science communicators from around the world. They've talked together through several different sessions on how to better communicate science during emergencies and discoveries of ways to make recommendations to our populations that are more actionable and understandable. So we've looked at this aspect from several different lenses. We talked to science communicators who were more involved with research. We talked about science communication through the media and also with decision makers and through educators. Together, this will come forward with some recommendations for how both the World Health Organization and all of our different stakeholders can better communicate science in the future. This event today will feature 5 expert keynote speakers, and each will present for around 15 to 20 minutes, and we'll have 2 discussion periods. We invite your questions and answers. Please submit those in the Q&A function on the Zoom outlet in the bottom of your screen. Today, we also have live interpretation. Please click on the globe to find your language. We're going to launch today's session with Dr. Sylvie Briand, who is the Director of Global Infectious Hazard Preparedness here at the World Health Organization Health Emergencies Preparedness Program. Thank you, Sylvie.
So I start again. Thanks a lot, Lindy. Good morning, good afternoon, good evening, everyone. I would like to warmly welcome you to the closing session of the WHO's Global Conference on Communicating Science During Health Emergencies. Today, we are concluding 3 weeks of discussion about how we can make the evolving science during health emergency relevant, understandable, and accessible to all. This global conference has made one thing very clear. Science is important to everyone. The way we communicate science can make huge difference in how people prepare for and respond to a crisis like COVID-19 pandemic. Over 3,000 people joined us for the public opening session of the conference 3 weeks ago. Its recording was watched more than 10,000 times on YouTube, and over 2,000 people signed up to join us for today's closing session. These numbers show that you are interested in understanding how scientific processes work. People want to know how to base decisions on evidence. The discussion with experts from all around the world disclose some of the challenges science communicators have been facing during this pandemic. From science being instrumentalized for political purposes to lack of scientific literacy and a flood of information that does not take into account the target audience's needs, beliefs, and values. While the pandemic has been challenging in many ways, we are also taking many lessons learned from it. First, we need to better communicate what science can and cannot do. Scientific knowledge generation takes time, is built on scientific debate, and inherently linked to uncertainty. It's important to explain scientific processes to policymakers, journalists, and the wider public. This will prevent them from losing trust in science when the constantly evolving evidence leads to changing public health recommendations. Second, we should listen more to concern, belief, and needs of the people that we are trying to reach. Instead of simply pouring out information, we need to have a constant dialogue with our communities to ensure the scientific information is relevant, understandable, and credible to them. The continuous dialogue with different stakeholders will also help to build trust in science and encourage people to ask questions and voice concerns. Third, we want to be creative and innovative when communicating science. People consume information on different channels at different time of day and in different formats. We need to make sure that scientific information is presented in a way that resonates with the target audience. Science communication should add to people's lives in a meaningful and action-oriented manner, instead of merely adding to the flood of information the pandemic has brought about, creating an infodemic. Today, we are welcoming two invited keynote speakers who use storytelling, humor, and social media to provide their audience with trustworthy and understandable health information. In addition, there will be 3 innovative science communication concepts that were submitted to our global call for good practices examples. One example combines science and art. One promotes an open dialogue about rumors and concerns linked to COVID-19, and one explains the global consequences on the pandemic to children. All these examples show that even in the darkest of times, people still think about each other and help others to understand the impact of COVID-19 and how we can cope with it. We will also hear more about the outcomes of the expert discussions held over the past 3 weeks. We would also like to learn from you all and make this event as interactive as possible. I greatly encourage you to submit your questions and comments via the Q&A function on Zoom. Your input will help us to understand how we can better translate science in the future. And with this, I wish everyone an excellent closing session and hand over to my colleague Melinda Frost, the moderators of today's event, for the housekeeping announcements and the introduction of our speakers. Thanks to all.
Thank you, Sylvie. Well, we look forward to hearing more from our presenters today. As Sylvie and I mentioned, we have 5 keynote speakers, and we're really hoping to hear and have a lively discussion with you as well, our participants. So again, we invite you to submit questions in the Q&A function on the Zoom at the bottom of your screen, and we'll be pulling those to have an open discussion with our presenters throughout today. We're going to start off today's session with 2 keynote speakers. The first is Lizz Ntonjira, who's the Global Communications Director for Amref Health Africa in Kenya. And the next keynote speaker will be Mikhail Varshavski, who is also known as Dr. Mike, a board-certified family medicine physician and content creator, quite popular on social media in the US. So first, let's go to Lizz, who's going to give us a presentation titled Rethinking Communication, Storytelling in the Age of Misinformation and Disinformation. Lizz?
Thank you very much, Melinda. Greetings from a very chilly Nairobi in Kenya. This is a really amazing topic that I love, that I'm quite passionate about. My name, once again, is Lizz Ntonjira. I'll be taking you through a presentation around rethinking communication and storytelling in an era of misinformation and disinformation. Sorry, I got a bit distracted. I was trying to share my screen. Just 1 second. Great. I think you can all see my presentation. And for those of you who do not know Amref Health Africa is one of the largest health development organizations headquartered here in Nairobi, Kenya since 1957, serving over 35 different African countries. We also do have 12 Europe and North America offices and subsidiaries that include Amref Flying Doctors, Amref Health Innovations, and Amref International University. On the onset of the pandemic, we have been at the forefront supporting different African governments in their response measures to the pandemic. We've also been working with different stakeholders, including the international development sector, private partners, as well as the public partners, in ways we can be able to respond to the pandemic at the community level. My presentation today, and whenever we have a conversation around misinformation and disinformation, it reminds me of this African proverb that states, when the roots of a tree begin to decay, it spreads death to the branches. And as you can see on the right side, this is flourishing, it's green, it's flourishing, it's healthy, because it's getting all the nutrients that it requires. And that's sort of how it resonates for me. When you get the correct information from the credible sources, you thrive, communities thrive, people are able to, you know, have a healthy ecosystem, as well as respond to different issues that arise within the health emergencies. When you look at the left side, it just spreads death. And this, for me, really is symbolic of when we consume the wrong information, sometimes it can lead to death. So for us and for me, it is really pertinent and important for us to always have the correct information. And the correct information comes from a pool of different scientists and different stakeholders working together. And the pandemic really showed us how, you know, communication and health communication has really come to the fore of ensuring that people understand what they need to do to protect themselves and protect their loved ones. Now, whenever I see or read different pieces from scientists, they could be very helpful research pieces that are pertinent to the well-being of different communities. But when we did a survey with various people, the jargon that is used, the words that are used, the context that are used, sometimes become difficult to resonate with different audiences. And it reminds me, and I try to think of what does it remind me? It's really important information, but sometimes people are unable to unpack it. And it reminded me of this.
What? Huh? You better stop.
And I felt that this little girl, credits to Funny Plugs for giving permission to use this video, reminds me of a scientist who's really trying to give information through either research work, through the conversations that they have, through the healthy debates that they have with different other scientists. However, that information is not able to be unpacked, and you see people struggling. So because of the analogy of baby talk, it is very important. Maybe this child is saying something that is critical to them, that maybe I need a change of diaper, maybe I'm hungry, I need some food. However, the parent is left, and the parent is the consumers of that information, are left with a varied number of interpretations of what the child wants. And it kind of resembles those research studies. It leaves people wondering, okay, so how do I interpret this? And individual people interpret it differently. They go share that interpretation that is based on either assumption or some missing bits of information to other people. Then it continues to become a snowball effect, therefore creating disinformation and misinformation. Now, the communicating health information and science is really important. However, it has to resonate with different audiences. And for me, content, audience, and channel is really critical for the demographic that you're going to have consume that information. Credible sources, diligent research. We've seen during the onset of the pandemic, it becomes increasingly difficult to decipher from fact and fiction, particularly when scientists who we know are credible sources publicly differ on opinions that are so great that impact and affect lives of people. So when I say diligent research, and I think Shamila from UNESCO did mention, peer-reviewed research is quite critical. Fact-checking is just as important. trusted media outlets, and I'll underline the word trusted because with the onset of new media, we've seen everybody, because of access to the internet and access to a smartphone, becomes an expert in one way or the other. So credible sources are quite important, and trusted media outlets are quite important. Thought leaders, community champions are crucial. During the onset of the pandemic, one of the key things we would often hear is social distance, put on a mask, wash your hands uninterrupted for about 30 or a minute or so with soap and running water. However, that reality for a lot of countries in Africa who are developing countries, it became sort of like a mirage. How do we clean our hands when we don't have water to drink? How do we social distance? Well, the reality is in a lot of informal settlements in Africa, people live less than 2 centimeters apart. When it comes to masks, how can I afford a mask? Well, I'm trying to feed. I don't have food for my family. So that information needed to be really cut down and contextualized to the different audiences because it became impossible in some demographics to actually implement this. Debunking myths and culture considerations. I'll give an example of why health communication is very important in terms of considering some cultures. We have a program that stops female genital mutilation and cutting. However, these communities really believe in the practice. So we don't go to those communities and tell them and give them the scientific analogies or reasons why FGM is harmful to women. On top of that, we add the layer of giving them an alternative. And that's what we love doing. A huge number of our projects, initiatives, programs across Africa is informed by Lao Tzu's quote that says, go to the people, live with them, love them, learn from them, start with what they have, which is really important. Start with what they have, and then build from what they have. And when the task is done and accomplished, the people will say, we have done it ourselves. So ownership from the community is really important. So even in the pandemic, just having that critical information of how people can be able to, even in the informal settlements, to sort of at a considerable length, adhere to the guidelines that had been put out was really important. Use of visuals, imagery, cartoons, animations, which I'm sure has been really spoken about during this entire conference, syndicating content to resonate with different demographics. I know a lot of the key information is usually translated into the key UN languages, but how can we work with different organizations in Africa to ensure that it is also translated into the local dialect, putting into consideration the literacy levels within some developing countries? Having healthy debates, focus groups, and expert interviews goes a long way in ensuring that people understand and are able to demystify this health issues that are of great concern to a number of people. And one way to do the expert interviews, for instance, in the Africa setting that we have done, is talking to community champions, the people within communities who are trusted, use of community health workers, use of the elders within those communities, so that then we ensure that no one is left behind with the messaging. A key barrier to the information dissemination that we found out within the local context in different countries in Africa is the lack of clarity. And this has been a huge issue of in science communication because of the use of jargon. How do we ensure that a 3-year-old, a 5-year-old is able to understand some of these issues? How are we able to, unpack an entire 50-page research paper that has really pertinent information about various health issues into just a 2-page infographic? there's often a lot of information overload. How are we able as health communicators, as governments, as different health development organizations, how can we stop the information overload? And how can we be able to merge different studies so that people, the end consumer, really understands the issues at hand? In a world of distracted communication, it is really important to just outline the key messages when it comes to different research, different issues, and for the pandemic, to put the pandemic into context, I really love the fact that it was 3 key things that were put into place: social distancing, making sure you put on your mask, wash your hands or with soap and running water, or sanitize. And this was really, really important. So how do we, for every scientific information or health information that we have out there pertaining different things or different health issues, how can we make sure that we narrow down the top 5 or top 3 key things that we want individuals or a community as a collective to understand and to articulate? And I always say articulation happens in 7 ways, using the 7 C's, which is clear, concise, concrete, correct, coherent, and complete, and courteous information. Courteous is really critical because what we've seen in Africa during the onset of the pandemic was guidelines were put out. A lot of people did not understand, what are these guidelines for? How am I going to feed my family if there's a total lockdown? And one of the key things that happened is there were deaths that happened because somebody was found not putting on a mask. These are deaths that could have been avoided. And that's why courteous is really important, ensuring that everybody understands why they need to take care of themselves, and collectively in doing so, they're taking care of the entire community instead of having those measures forced onto them. Now, as an organization, we've been tackling misinformation and disinformation in various ways. We launched a health journalism course in our international university that ensures that different journalists, health journalists from different parts of Africa are taken through an intense 4-week course. And there's fieldwork that they get to do to really understand what it means to cover health issues, particularly during a pandemic, how to ensure that even when they're looking for subject matter experts, when they're looking for analysts, when they're looking for expert interviews, how do they identify those? How do they make sure that the sources of information are credible? One of the other key things we've done is training of over 100,000 community health workers at the community level to educate societies and families door to door, going and knocking and finding out ways and educating them on ways to protect themselves during this pandemic, and not just the pandemic, but also during how to avert other health concerns like malaria, like diarrhea, dysentery, all those. Now, community health workers or community health volunteers are usually people that are picked within communities to give them information. So they're trusted champions, champions of information, health informations that we really love to use, because then they're trusted and people tend to believe what they are saying. Launch of the Africa COVID-19 Information Center, which was the one hotspot where you could find information regarding COVID-19, the emergency lines, etc., all in one portal. If you want to find out information about COVID in Algeria, if you want to find out in Nigeria, if you want to find out from Kenya, Ethiopia, all this information was clustered into one portal, the Information Center. And this for us was really critical in terms of thought leadership and ensuring that we're getting the right information to people. And it was quite befitting when we saw this particular source of information get ranked top 10 globally as a key source of information. So when anybody goes to Alexa and says, Alexa, I need information around COVID in Tanzania, and our platform would be picked for that. One of the other things during the onset of the pandemic is we felt that persons with disabilities were left out during all this communication that was put out. So we developed in Zambia, we developed information, education, and communication materials in Braille to cater for persons visually impaired. And this is a practice that we sort of replicated in the other African countries. We developed an Ask Daktari segment, which was going to give expert opinions around different issues, particularly now on vaccine hesitancy. Vaccine hesitancy is a growing concern here in Africa. We've seen in some countries, unfortunately, whilst we're looking for vaccines and we're needing vaccines, some vaccines in some countries are expiring. So one of the key things is ensuring that if we invest in vaccines, we invest as well $1 invested in vaccines, $5 invested in ensuring that there's information and communication put out to the communities to make sure they understand the need and the value of the vaccines. Research studies to counter disinformation. During the pandemic, we've had an average of 30 research studies all around COVID-19 that have been peer-reviewed. We've had different roundtables with different stakeholders, key of them being media, to ensure that the right information is getting to the media. Journalist webinars and roundtables to demystify and debunk various health topical issues. Like I'm sure I've had a couple of speakers talk about the BCG, where in Africa people were not dying as it was in other Europe and North America countries. Was it something in our DNA? So just debunking and demystifying that with expert people, that really is an initiative we had took up. We set up an Amref hotline and a speaker bureau for easier access to health experts. We saw that a lot more newsrooms were prioritizing health. However, because it had not been prioritized for a long time within Africa, there was a serious lack of experts, subject matter experts around different topical issues. So we're able to provide this hotline and speakers bureau for any stakeholder, whether it's in the private sector, whether it's the media needing to speak to various experts around COVID issues. We had partnerships with tech organizations, for instance, as Twitter, to immediately reach out and address any mental health emergencies or cases. One of our research studies talked immensely about how the COVID-19 has impacted young people, and mental and psychological distress was one of the key things that was identified. And this partnership really helped us in whenever anybody tweeted anything that was alarming, they would quickly get a message telling them, call this hotline, call this number if you need any help or to speak to somebody, and we've seen quite a lot of benefits from that. We launched a number of online campaigns that reached millions of people, that then all these online campaigns informed our offline initiatives and advocacy work, which was really critical during this pandemic period. One of the things we realized, though, is a lot of organizations, and I think even from the various presentations that have been done, is a lot of organizations are doing work in silos, but we need to collaborate more. We need to engage more as private sector, as public sector, as international development organizations in the international development space, so that then we come together to conquer a lot more instead of doing the same, different organizations doing the same thing to the same target group. So partnerships are really critical during this time, educating and empowering communities. And we've seen the use of imagery, comics, we've seen a use of cartoons for kids, for instance. We've seen how this education is really important to even just going to schools once they reopened in various parts of Africa, and educating and drawing cartoons and trying to make young students and pupils understand, information is power, but with power comes a lot of responsibility. We have to ensure that we're giving the right information. Diversity and inclusion, that's one other thing that I feel that even as we're communicating health, we need to be really cognizant of language barriers. We need to be cognizant of persons with disability, because I feel like that is one area within even health communication and science communication that we've not done well in. How can we better ensure that no one is left behind? Everybody is getting the critical information. It has been packaged in something palatable that they're able to understand from whatever demographic they come from. Investments into health communication and advocacy. So for a long time, whether it's in different organizations, whether it's in the newsroom, we've seen health not really prioritized. We always say health is wealth, but more often than not, it is not prioritized. One of the key things that needs to be done is investments, not only into, now we're having conversations about vaccines, how can we also invest into education and information and knowledge and building capacity and skills around these pertinent issues? How do we ensure we reach the last mile? So that's really important. Prioritizing health and science reporting in the newsroom. So in my previous life, I was a news anchor, producer, and reporter. And one of the things that we'd really struggled with is politics always took precedence, particularly in the African setting. But now, more and more, it shouldn't take a global pandemic to prioritize health. How can we ensure editors and different media outlets really prioritize health? How can we ensure that there are more health topics, more health shows in the various languages within Africa that resonate with their audiences? How can we ensure that we prioritize health in the newsroom? And last but certainly not the least, more public-private engagements and alignments. It is really critical to have these conversations, to have these partnerships, to ensure that we're not duplicating effort, that we can be able to cover more ground when we come together. I think those have been some of the learning lessons that have really taken precedence during this time. And with that, that's the end of my presentation. Thank you.
Thank you so much, Liz. And thanks for sharing your experience at Amref. Really, really nice to hear about the work that you've been doing and the lessons that you've learned that I trust probably echo around the world for many of our responses for COVID-19. So thank you so much.
Thank you.
So we'll turn next over to Mikhail Varshavski, otherwise known as Dr. Mike. Dr. Mike is a multifaceted, board-certified family medicine physician, media personality, educator, writer, and philanthropist. During his residency, Dr. Mike decided to document his journey and share his medical learnings with the internet. Over the next few years, he garnered 651 million views, making his platform one of the largest in health education. So welcome, Dr. Mike. He has a presentation for us today called Alert, Not Anxious. Thanks.
Thank you so much for that introduction, Melinda, and amazing presentation, Liz. That was so insightful, and it's amazing to see all the work that's being done on your end, educating the world when it comes to COVID-19 and beyond. For myself as a family medicine physician, I learned early on the importance of health communication as a student. I would be in a room with a brilliant physician who knew all the up-to-date information, who knew the correct way to make a diagnosis, to recommend the correct treatments, and they would present this information to a patient. And then they would walk out of the room. The patient would turn around and look at me, the medical student, and say that they have no idea what the options are. They have no idea what the correct move is. And I realized that having all of the knowledge is amazing and important in a quality physician, in any healthcare worker for that matter. But if you aren't able to communicate that, make sure that the patient understands what you're saying, make sure that you're speaking at a health literacy level that is applicable to them, it's not enough. And then I started looking at this in a bigger picture and looking at the landscape of health communications. And I saw that there was a missed opportunity. There are billions of people online logged on to social media. Their eyes are focused on their phones. They're focused on their computers. They're spending less time looking at televisions. And yet there weren't many physicians or healthcare educators online sharing quality information. What happened as a result? Misinformation thrived. It started getting a huge platform. Millions of people were sharing information online that was not accurate. And this happened because physicians were afraid of being labeled unprofessional. There was a fear that if you were to take a selfie or you were to make content that was perhaps comedic in nature, that was somehow unprofessional. But the reality is, we may be physicians, we may be healthcare workers, we may be community healthcare workers, nurses, what have you. But at the end of the day, we're humans first. And when you're receiving information from somebody, you want to receive information from another human, not a robot, not someone who's dictating the things you have to do, because we don't relate to that individual. And when it comes to receiving healthcare information or sharing healthcare information, we have to look to human psychology. And the title of my talk today is Alert, Not Anxious, because at the beginning of this pandemic, there were so many unanswered questions. There were so many things that patients wanted to know, but we didn't have the answers to. And when we're thinking about human psychology, we have to first think about relating to another person. And if you can come with a relatability and a level of humility by saying, I don't know, that creates a very strong bond between you and a patient, or even you with a viewer. And this Alert, Not Anxious motto was taught to me by one of my attending physicians when I was in medical school. And it was really applicable to any medical ailment, including mass communication with COVID-19. What does it mean to be alert, not anxious? It means to have your ears open and be ready to accept new information. What does it not mean to do? To not become emotional and worried, so much so that it starts impacting you negatively. When I think about who does healthcare when I think about who does communication well, I think about marketers. They're very successful in getting us to buy products. They're very successful at getting us to know about the brands, companies that they represent. And there's specific topics and techniques that they use to influence these decisions that we make, these purchasing decisions. And I thought, why don't we, as healthcare communicators, as doctors, as nurses, look to them as guides and take away what they do well, but use it to educate, to inform, to influence the decisions of our patients and our viewers. Because ultimately, the term influencer should apply to any healthcare worker. Because what we're trying to do and our goal is to influence the health decisions of these individuals. And it's because we want to present them with the best information. We want them to take that information and use the best and make the best decisions for themselves and their family members. What do marketers do well? They use the power of anecdotes. They tell stories. They draw you in with a relatability aspect that we as doctors fail to use. We talk about data, we talk about numbers, but a lot of people don't have time for data and numbers. And also you can repackage data and numbers to suit your own goals and your own needs. So it becomes very confusing to the average person when you have numbers thrown at you from all sides. In fact, we live in the age of information overload, where new phones are coming out every 2 months, it seems. New computer systems are coming out every month. News is constantly giving us alerts and warnings. We're very interconnected as a global society, where if something happens in one nation across the world, we hear about it here at home. And while that is a good thing, it is also incredibly overwhelming. And the way that our minds work is they want to simplify this process. They want to hear something and they right away want to know true or false, true or false. And the way that we can help facilitate this for our viewers, for our patients, and to make communication better during a pandemic like COVID-19 is to simplify the information we're presenting, is to present it as a human first, not as experts, to tell a powerful story, to utilize the tools that are at our disposal. Social media is a beautiful thing. We've villainized it because we've said, and we've seen some of the harmful effects that can come as a result of social media. Rates of anxiety have gone up. Mental health illness has certainly been affected by social media. There's been bullying, negative comments, but it's also connected the world. There are true positives to social media. We're able to reach millions of people by putting out a piece of content and impact their decisions for their family, for themselves, and for their friends. So for me, I can, from my own computer here, record myself making a message that is relatable, that is understandable, and send it to millions of people across the globe and have true positive impact from it. I never thought I would be able to say this in my early medical training, but by making some of these videos that I've done online, I've impacted people's decisions to get vaccinated for COVID-19. I've educated people about performing proper chest compressions if someone's heart is to stop and what they should do first. We've impacted the trust that patients have with their doctors, or maybe even encourage them to seek medical care and go for their screenings. And these are difficult things to do when you're not in a room with somebody. But the reality is we have to make use of the tools that are at our disposal, like social media. One of the ways we could do this is through collaboration. This is why I'm so proud to share the stage with Lizz today and all the other amazing keynote speakers, because what we're doing here is we're collaborating. We're using our joint forces to come together and present the topic to a large audience. We're streaming this conversation live on YouTube right now. We're making use of this platform. That's not so easy. We have to first understand how these platforms work. Each platform has specific verticals and specific formats that work well for them. For example, YouTube works well with a little bit longer form content. TikTok works with shorter form content. Instagram perhaps works with photos. Facebook works better with community groups. But the more we learn about each of these platforms, the better we can tailor our messages to these platforms. Because at the end of the day, if we are successful in understanding the algorithms that are driving these platforms, the further we can spread our message. There is no greater impact I can have on the impact of the global response to COVID-19 than to understand how the algorithm works for, let's say, YouTube. Get that algorithm to share my content globally, put it on the front page, to share it to more viewers, and the impressions skyrocket. And now you have individuals across the world learning accurate information, easy to understand information, and you actually see the results of bringing people together. The idea of being relatable and putting accurate information together truly can be a winning formula, because as I said in the beginning of this conversation, people want to hear a human. They want to hear someone who has gone through the same troubles they have, who can be empathetic, who can be humble. Because too many times in healthcare, we've been trained to say, lead with the data, lead with the science. And that is a beautiful thing, because science is a great concept. But the reality is not all of us truly understand science. Not all of us truly understand data. And data can, like I said earlier, can be easily manipulated. So we have to come with that humble approach. We have to not be afraid to say, I don't know. Because the reality is there's so many more questions. You could ask any PhD. The more you learn, the more questions you have. And the more you can present with this approach, this humble, empathetic approach, like the 7 C's mentioned by Lizz earlier today, using that compassion, using that humility, pairing it with the reach and the algorithm-driven success of social media, the millions of people you can reach across the globe. And I hope that folks can look at my social media success, where we're nearing 1 billion views on my YouTube channel, and build upon that. I urge you, do better than I have. Learn from what I have done and improve it. Because I myself was just a family medicine resident not 4 years ago, speaking to 20, 30 patients a day. And I've taken those conversations and we've exploded them worldwide. So look to social media, lead with humility, think about compassion, think about speaking to the human in front of you, and the success that we can have in educating throughout this pandemic, future pandemics, future healthcare emergencies. We're going to have even more success. And with that success, we will save lives. Thank you.
Thanks so much, Dr. Mike. And I really appreciate that both Liz and you touched on the importance of speaking with empathy and compassion and simply just being human throughout this. Thank you so much for your work. So we're going to go now to a discussion with our participants online. We have a couple of questions lined up. And the first question I'm going to throw to Liz. Liz, we would like to know a little bit more about how Amref has been able to tackle misinformation, and maybe particularly when it comes to stigmatization, terminology, and mental health issues.
Great. Thank you. Thank you, Melinda, for that question. And thank you so much, Mike, Dr. Mike, for that amazing insights and knowledge that you've shared. One of the key things that we've done on top of just launching the health journalism course, we've also tried, remember during the onset of the pandemic, there was a lot of data and scientists love data. 50.5 million people, X number of people. And for a very long time, we would often see, and I think that drove, even through our research work, we saw a lot of people raise concerns around mental and psychological distress, because what they would often consume is number of deaths, number of infections, and we'd hear less about number of, recoveries. One of the things that we tried to do, instead of just using data, is to put a face to COVID. A lot of times people thought, oh, COVID is maybe something that would get somebody else and not me. And just so putting a face, a story to some of those numbers was really important in showcasing to people it's you or me, it's anybody can get COVID. So that's why we need to be very careful, because for a very long time, and we've had conversations with a number of people, they felt COVID was far-fetched. I've not been on a flight. I've not been anywhere near anybody who's been from a flight. So I don't think I have it, but just putting a face to the disease, putting recovery stories out there, that really helped with stopping the stigmatization. Because we'd see, even in communities, when our community health workers started sharing that information, people began being skeptical and thinking, why did you go to that household? Does that household have COVID? One of the key things that we've done, just going back to my quote of Lao Tzu, going to the people, loving them, being with them, starting from what they have, build from what they have, is in some typical pastoralist communities where isolation is difficult. We have, we built isolations with the manyatas. The manyatas are small huts where they would stay in, and we showcased those stories so that more and more increasingly people felt, oh, so this is something that I can manage. This is something that if I get, I won't die. In terms of mental health, our partnership with Twitter has really benefited in terms of being able to capture some of the worrying comments that people might put out, and they would automatically, so if I tweeted something like, I hate this world, I'm done, you would get an automatic message that says, please reach out to, or one of our people will reach out to you, please check your DM or follow back for a DM. So then we were proactive about reaching out to people, having different conversations with different demographics, whether it was older people, young people, children, ensuring that everybody understands the role they need to play. And this is something that we made sure we make people understand, that COVID or any health emergency is not a responsibility of the government alone. It is a responsibility of everybody within that health ecosystem, which involves the citizens.
That's nice that you've brought the citizens into the response through some of the stories that you've been saying. Thank you very much. I'm going to switch it over to Dr. Mike. Dr. Mike, we at WHO have struggled, as have many other health organizations, public health entities, in the ever-changing science of COVID-19. Our mantra is always, say what you know, say what you don't know, say what you're doing about it. But how did you deal with all of the uncertainties around COVID through your social media work?
Yeah, it's a really important question because we know science evolves. And that's why when we say trust the science, we're not saying trust necessarily each individual scientist. We're saying trust the process because science is evolving, it's self-correcting. In fact, there's a great book on this called The Half-Life of Facts, showing that just because something is a fact today doesn't necessarily mean that it will be a fact tomorrow. And that's why we have to be open-minded. So with each one of my pieces of content, even if it's not about COVID-19, I try and instill the principle that we can be wrong as healthcare leaders. We can make mistakes and explain our thought process, why we've come to the conclusion that we've come to. Another thing that I frequently reference in my videos is the power of saying that I will not be speaking in absolutes. It's very easy to say we should not be doing this versus we should not be doing this right now because it's almost like a form of motivational interviewing, but it's a form of motivational presenting where you're explaining a statement followed by a justification why you're making the statement. And the idea of if, let's say, something has changed, immediately getting in front of it and explaining why that fact has changed, because it's very easy to lose the public when you start changing guidelines, once you start changing recommendations. And part of what my content has been throughout this pandemic is constantly going in and explaining why this has changed. Why, if you look at someone's statements a year ago, they might be different than what they are today. And the more you keep the public updated with this, and the more you keep them engaged throughout the entirety of the pandemic, the more they can follow along and understand your justifications, why these things have changed. And just to address some of the comments that I'm seeing pop up in the Q&A when it comes to marketers and thinking about, quote unquote, being manipulative with your information, I think manipulation carries a negative connotation because we're taking the term influence and then you put a negative spin on it when it comes to, let's say, marketing nonsense products, products that claim to have miracle cures. Really what I'm talking about is influencing someone by learning the strategies marketers use to keep attention, to get people looking at the screen, by using specific imagery, using specific strategies in storytelling, taking those concepts and then using that to educate, to expand and grow on an algorithm, not to trick someone into doing something that's bad for them. Instead, you're tricking to get their attention and then allowing them to make the best decision for themselves.
Okay. Thanks for explaining that. That was going to be my next question anyway. Thanks for leaping there. No worries. So Liz, let's go back to you. And I'd like to really hear more about some of the methods you've used and what did you really find to be the most effective with the communities that you try to communicate with?
Absolutely. Thank you, Melinda. One of the biggest things that we saw, of course, with the advent of new media is the use of social media in some debunking and demystifying some of the myths that are surrounding the pandemic response. Mm-hmm. However, when you try to contextualize, not every person, if you solely focus on social media, you leave a huge demographic, particularly in developing countries. We don't have as good as internet penetration as some Europe and North America countries. So one of the biggest and greatest assets has been using community radio in local dialect, in the local lingo that different audiences can understand. So that was really, really critical and helpful. One of the other things that we did was educating and holding different sessions, equipping, subject matter experts who are mostly doctors or scientists. We have very few Dr. Mikes, people that can really be able to resonate and articulate different issues with the audiences. We often know doctors as the people who write in a handwriting that you're not able to understand. They're always very stoic and very reserved. So one of the things that we did with our experts, is our subject matter experts within different priority countries, is we did a media training for them. Communication might look like very simple, that you're just sharing information with a set of individuals. However, it's very hard for people to do public speaking or to engage with the media. So we ensured we equipped the skills, enhanced those skills to ensure that they focus on the pertinent issues. How do they address different demographics? So that was really key in ensuring even the focus groups in different communities that we had were helpful. The other thing that was very helpful was our LEAP platform. So the LEAP platform is a mobile and digital platform that provides education and courses around COVID-19 to different people, particularly our community health workers. I saw a question about how do clinicians, for instance, how are they able to articulate these issues, or people who not necessarily are experts when it comes to health emergencies. So we developed a course on COVID-19 that was easily accessible whether or not you have internet. That's called the LEAP platform. And this was really beneficial. We saw different countries uptake it. It's often been used, and the curriculum has been endorsed and approved by the various ministries of health. We saw, for instance, during this the pandemic, Ethiopia, the Ministry of Health in Ethiopia took it up and is the sole platform that is used for mobile learning. So those are some of the initiatives that we've undertaken to ensure people are getting the right, credible information to protect themselves and their communities.
That's really impressive, Liz. Quite a while ago in my career, I did some work with Amref, and it's really nice to hear how the initiative's grown and the excellent work that you've done during COVID-19.
Yeah, absolutely. And I have to add that, instead of reinventing the wheel, in fact, on our COVID-19 Information Center, or a lot of the materials that we syndicated, we relied on Africa CDC and World Health Organization just to syndicate that information to the local communities as well.
Mm-hmm. Mm-hmm. Okay, thank you. So I'll go to the next question for Dr. Mike. Dr. Mike, globally, we know that healthcare workers and physicians are one of the most trusted sources of information. When it comes to social media, we all know it can be a bit of a minefield and very time consuming. So what kind of advice do you have for other healthcare workers in using social media and understanding the algorithms behind them?
Sorry, I'm just fixing my microphone here. I think social media can absolutely be a minefield. There's a lot of mistakes that can be made and also be prevented, because when you're speaking on social media, you're not speaking to an individual. You're speaking to potentially millions of individuals. And anything you publish online, you have to remember that is there permanently. Even if it is on a medium where it disappears after 24 hours, a copy of that information will always stay and be accessible. So you need to be cognizant of the fact that you're speaking not only to people who want this information, you're potentially speaking to people who don't want this information, people who disagree with you as well as agree with you. So you have to present this information very neutral, very compassionate, very understanding, number one. Number two, you have to understand how each of these platforms work, how they dictate what kind of information they serve to their viewers. For example, we look at the YouTube algorithm, and in order to understand what is successful on YouTube, we have to look at human behavior. That is literally what YouTube's algorithm is meant to do. It's meant to predict user behavior, what is going to keep the viewer engaged, watching, and also they've added a new metric of satisfaction. So the way they do this is they will give surveys after users will watch a video of how much they enjoyed this particular video. What was good about it? Was it life-changing? Was it educational? Was it inspiring? And they take this information, they use it to decide who should watch this video also. And the more you study these platforms and you understand what is successful, the more you could tailor your approach. This doesn't mean that every healthcare communicator needs to be on social media. it means that this is one underutilized tool that we can come together and use. Also, partnering with major organizations, the WHO, the CDC here in the United States, partnering with individuals like me who understand these platforms well, and we can come together and reach a huge audience is also an untapped resource. So not everyone should be on social media. Not everyone needs to be in front of the camera. There's so many roles that you can play in facilitating this healthcare information spread, whether that's writing content, presenting graphics, creating animations, doing voiceovers over graphics. There's a lot of ways people consume this information, and it really depends on the platform. So educate yourself on the platform, find a role that works best with your skill set, and really the world is your oyster at that point.
Nice, thanks. That's pretty inspirational. Sure, we'll see a lot more physicians online now. So, Lizz, I'm going to go back to you. I'd really like to hear more about how you've been able to take your online work and shift it to some of your offline work. In Africa, there's many lower resource settings where individuals don't have access to social media. So how have you been able to take one world and bring it to the other world?
Absolutely. So during the onset, there was a lot of information that was put out. So we invested heavily on ensuring that the LEAP platform, we have a module and curriculum that is approved. We ensured that we had information, education, and communication materials out. However, I remember seeing this comment that somebody says, what about persons with disability? What about people that are not able to read these messages or hear these messages? What alternatives do they have? So that kind of challenged us and was informed by our online campaigns and conversations to have tailor-make information communication that was in Braille to cater for persons with impaired vision. So those are some of the things that informed our communication, our initiatives, offline initiatives. Another thing that informed us is, the whole conversation around social distancing, mask up, clean your hands with running water. A lot of people got back to us and said, what about those people who live less than $1? How will they get this running water? They don't have water to drink. So this informed some of our proposals, and we launched a fundraising campaign around responding to the pandemic that would go to ensure that people in the informal settings have access to sanitizers. And working with different partners, we were able to get sanitizers, for instance. We were able to get hand washing facilities set up within those informal settings. We were able to have people volunteer and become, innovative. So if they're not able to put up the hand washing facilities that were expensive, communities would work together to put up tippy taps. I don't know if the audience knows tippy taps, but yeah, those were really helpful. Just having these conversations, looking at the trends, analyzing what demographic is talking about this, really informed a lot of our offline initiatives.
Okay, nice to hear. Thank you. Dr. Mike, you've had quite, play on YouTube with lots of viewers. One of the things that we work on at WHO is not just taking our social behavioral data in to help inform some of our communications, but then looking on the backside at the results. And this is a difficult thing to do when it comes to communication, no matter what. Do you have any sense of the work you've done and whether or not that's led to any behavior change with your audiences?
Yeah, I hate to solely point to anecdotes, but unfortunately, it's very difficult to do a proper evidence-based research gathering here. For me, the way that I've tracked user behavior is the fact that I'm getting people to watch a dense video, a dense interview with heavy medical information, and still have it grow in a platform where it's competing against something that's funny or entertaining or music. That's very difficult to do. And if I'm pulling people in against those videos and still having success, And then also on the back end as a physician, I'm having patients come in and thank me and say that they've used those videos to educate their family members. They've played them during their Zoom meetings. Companies have come to me and said that they've recommended that their employees watch some of these videos. Those are the anecdotes that I rely on to show that people truly do resonate with this information. Also for me, I've actually worked with some organizations that look at the comments under videos, and they look through research to see positive versus negative words within the comments to see user sentiment and how they're relating to the information that's being presented. And one of the videos that they studied of mine was about reacting to individuals who were vaccine hesitant versus those who were pro-vaccine, and how I presented that information. And they saw that the video had like 90 to 95% positive sentiment within the comments, which is difficult on a video where you're talking about concepts that are sometimes controversial, when you're disagreeing with someone's viewpoint. And so far, the metrics on that have been very positive, and we continue to study that and continue to learn. But there is no direct evidence that I can point to say, look at the viewer behavior, it has changed. We have gotten people vaccinated. I think that the one thing that we can control and that I can control is we get the viewers to watch. And I could also see from the backend analytics that they're watching 60 to 70% of that video once they click on it. And if I have that, if I have the viewer's attention, my hope is that that will alone inspire even a small amount of change.
Okay, that's helpful and good to know. And nice that you're tracking it too, just to see how things are playing out. Great. One last question to Liz, and then I'll go one last question to Mike. Liz, what's next for Amref? There are going to be a few countries coming forward with, I think, maybe the third wave of COVID-19, which is going to present some really difficult situations. How are you preparing for that potential? How are you working with countries in the region to help reach out to individuals now?
Okay, thank you for that question. What's next is we continue to work in empowering communities, training health professionals and community health workers. We're trying to seek ways to foster better collaborations with the government because, in Africa, the government takes the lead in health emergencies, and our work is to complement their efforts. So that's one of the things that we're trying to do. We're part of the risk communication and emergency response in a number of countries. We are members of that. We're also trying to see how we can bring on board partners together with a shared goal and a shared vision. At the moment, we're really working on ensuring that there's vaccines for all. We put out a vaccine equity call, addressing various issues to governments, to development partners, to ensure that Africa is not left behind. We've been willing and we're happy to work with individuals and organizations that are pushing this agenda of vaccinations. We've seen in countries, and vaccinations is just not about the manufacturing of them, the ensuring that people get vaccinated, but also just making sure they have information, credible information on why this is important for them. We're also trying to see how we can respond to not just the pandemic, how do we ensure that our journey to universal health coverage is not forgotten by ignoring other rising health issues of diarrhea, of dysentery, of cholera, of malaria, of HIV, AIDS, and TB. How do we ensure that we're still addressing the challenges that we've constantly had while still responding to the pandemic? Because, malaria will not stop and say, oh, it's time for COVID to shine now, How do we ensure that the health ecosystem continues to thrive? And how do we ensure that our journey to universal health coverage within different communities in Africa is achieved while working with different collaborators. That's one of the things that we're really looking forward to, because we continue to support the government in testing so that we can get the accurate data and numbers within Africa of the affected. And those are, it's a collective effort for everyone.
Great. Okay, thank you. And thank you for your time today. Dr. Mike, I'll go to you for one last question. You have a really large audience that you've been able to reach, but do you take the time to think about who you're not reaching and maybe how to amplify some of the work that you're doing to those that, aren't part of your viewer base right now?
Absolutely. We're constantly thinking of how to expand the demographics of who we're reaching, and also thinking about not just individuals, but thinking about on a policy level and advocacy standpoint. For example, about a year and a half ago, I was on an airplane where there was a medical emergency flying from the United States to Tel Aviv. And a gentleman went into anaphylactic shock and did not have an epinephrine autoinjector. And the plane's emergency kit did not have that as well. So I had to create my own epinephrine kit out of the emergency medications that were on board, and we ended up saving his life. But through storytelling and explaining that story on my YouTube channel, I was able to partner up with a politician here, the Senate Majority Leader, Chuck Schumer, and we now have advocated so far to get epinephrine autoinjectors on many of the planes here in the United States. So my goal is not only to spread my information as much as I can to viewers, but also to policy leaders, to decision makers, and improve not just healthcare communication, but healthcare access, healthcare reform, and seeing if we can go even past just educating individuals.
Okay, well, thanks again for even more service. Thanks. It was really a pleasure to talk to both of you, Liz and Mike. Thank you. The future is bright thanks to your work. So we look forward to hearing more, and thanks for taking the time to join us today.
Thank you so much, Melinda. Thank you, Liz, for all your work too.
Thank you so much, Dr. Mike. Thank you, Melinda, for that. Thank you.
Great discussion. Great discussion. Okay, we're going to move on with our program today. And next I'm going to go to Dr. Radhika Patnala, who's the founder and director of Sci-Illustration. She's an expert in neuroscience and epigenetics, and also has conducted cancer biology research. She leads a team to solve design, communication problems for biotech and pharma while striving to bridge the line between science, art, and design. Dr. Patnala, thank you for joining today. She has a presentation called COVID Dreams, Visual Science, Communications Reimagined.
Thank you so much for the warm introduction, Melinda. And thank you, Liz and Mike, for emphasizing the importance of compassion in science communications. I'm just going to switch over to my presentation. Just a second. Okay. Now, again, thank you all for having me, and it's truly a privilege to be speaking to you all today. There is one sentence that always tugs at my heart. Stand on the shoulders of giants. I read this every single time I come to this particular website, and I come here a lot. I spent 10 years in basic research on my professional journey to becoming a scientist. And I was truly privileged to be in the company of some incredible people who are motivated, who are driven by curiosity, who have dedicated their entire lives to trying and understand how life works and doing anything they can to improve the human condition. We truly, every one of us, stand on the shoulders of giants, the people who work in these sectors and make this ecosystem work. When I started out, it took me some time to internalize and appreciate the complexity of the healthcare ecosystem and what it really takes to transform a discovery into medicine, and all the complex communications that need to occur to make things work. Because if any communication channel breaks down or isn't doing what it's supposed to do, any inefficiency takes patients farther and farther away from a life-saving medicine or a potential cure. Since the last 4 years, I have been on a personal mission to make these communications more efficient, to find ways to make extremely complex information more understandable and interesting to all stakeholders of the healthcare ecosystem that might have to communicate it, and also all the stakeholders that might have to consume this extremely complex information. And during this time, I have come across some key challenges that science communicators seem to face all the time. Science keeps becoming more and more complex, and not everyone starts at the same level of knowledge or interest. And so one of the key challenges that science communicators seem to face is bridging the gap in foundational knowledge across multiple stakeholders of the very diverse healthcare ecosystem. And a few of those challenges would be giving an accurate snapshot of how things work, making information understandable and clear, and lessening the scope for misinterpretation. Another challenge I see a lot is bulk of science communications is always information heavy and jargon heavy, as Liz mentioned before as well. And even if we make all the scientific research existing out there open access, is it truly accessible? Is it truly understandable? And even if it is understandable, do we have interest enough for someone to sit night and day, read through tons of research, and really appreciate the complexity and the nuances of science and the scientific method? And so one of the ways that I do think that we can help this situation is by making it more interesting, making it interesting enough to elicit curiosity, and curiosity enough to make information more understandable, and the motivation to understand that information. And so this is where it all started for me, to make things interesting. And so it was October of 2020, and it had been about 6 months since news about the coronavirus dominated our lives and almost all media channels. And the majority of visual representations of information about COVID and the visuals of COVID-19 that I came by in various public forums, they seem to consistently bring about feelings of sadness or suspense, danger, and most importantly, information overload. And over time, so in the beginning, it was nice. I was curious to learn more about COVID. I was curious to understand how it functions, how the virus works the way it does. But eventually, over time, I could also feel myself getting fatigued. I found myself avoiding the news, glazing over all the information. And I soon began to realize that in the situation we are in, with all the anxiousness and the restlessness, and us looking around and seeing the world around us change, I was also becoming a victim of pandemic fatigue. And at this point, I did begin to wonder, if this story could be told differently, if there was maybe a different way to look at COVID, could we represent the science isolated from the sadness of the events? Could we possibly touch upon important aspects of life and functioning of a society during a pandemic without the constant reminder of the pain and suffering it's causing? And please don't get me wrong here. I do not mean to live in denial or ignore the pain and suffering. I meant if we could find ways to cope better with all the negative emotions that the pandemic was putting us through. And around this time, I also came by a few very interesting articles in the public domain. And some of these articles mentioned this very interesting idea of pandemic dreams. And I found it very interesting. So it turns out that this is literally the first time in human history that because of this pandemic being such a shared human experience, we experienced a truly global dream surge event where all of this was being documented by social media interactions. There were so many people coming out and saying that they were experiencing strange dreams, and all of their dreams seemed to be slightly more vivid. And what it gave an opportunity to do was scientists could look through all these social media interactions and really start studies on how our dreams and our dream states were changed because of the COVID pandemic. Around the same time, I also crossed paths with a wonderful human being, a scientist and an artist, David Goodsell, who was at this time bringing together science communicators from all over the world to participate in a virtual science art exhibit, exploring the science of COVID. And so, taking all of these new thoughts together and trying to process them, I decided to start on a personal art project. I set some constraints for myself, and I decided that I would make a series of 10 artworks representing different aspects of COVID-19 science and the human experience. I decided that I would make one artwork every night, summing up my most prominent thoughts of the day. I usually tend to deal with a lot of information-heavy stuff and a lot of information-heavy scientific research content during my professional life. So for this particular personal project, I really wanted to indulge in a more abstract framework of visuals which were more interpretive and almost dreamlike. And so for this particular series, because I was already struggling a bit with my own mental health and trying to cope with the pandemic in my own way, I did want to use a more consistent, uplifting visual language just for me to feel better. And so day one, this is what I created. And I have to be honest, I'm not entirely sure what it is, but that was honestly my intention. I wanted to create something that could be interpreted by people, like how dreams can be differently interpreted by anyone. And what I did like, though, about what I had made was it made me happy. I liked looking at it. It got me curious to think about what this could be. Could this be a landscape in our body? Could this be the cell surface of a lung cell which might have been infected with COVID? It got me interested, and that is where I kind of nailed down the look and feel of this entire project. On day two, I was thinking about COVID-19, the virus particles flowing in our bloodstream. And so what I drew was, I drew endothelial cells which line the blood vessels, and I drew COVID-19 particles flowing through our blood. On day three, there was a lot of news about how people were not wearing masks, and that caused quite a bit of paranoia. And so I tried to really package all of my emotions into this artwork depicting what I was feeling. And by day four, things started getting a bit out of hand. And I woke up this day and I really thought, hey, I wonder what it looks like on the other side of the mask. And so that night I drew it. And so by day five, I was really itching to get back into the science of COVID-19 and how it functions. I always do find it quite interesting that viruses are neither good nor bad. Viruses are essentially life forms that we humans share planet Earth with. And it is a very fascinating life form, if you ask me. Viruses, so what I made here was really when viruses infect a cell, they hijack the machinery of the cell they have infected, and they make multiple copies of their genetic material. And what you see here in blue is essentially RNA, which is the genetic information of the virus, and almost like a production line or an assembly line of the virus replicating its genetic information inside the host cell, interspersed with proteins, which might be proteins of the virus or proteins from the host cell. And once the virus replicates all of this information, all of this RNA needs to be packaged into the very small space of the virus. And how that is done is with the help of a few other proteins, where the genetic material or RNA of the virus gets packaged around other proteins into a very tight, condensed space. And then I wanted to take a more of a snapshot view, so I zoomed out a bit. And what you see here is really like a cross-section of the virus, where all the genetic information is very tightly packaged inside. And it is also interacting with certain proteins on the membrane of the virus. And what you see here in yellow is the all-famous spike protein, which is also interacting with its outside environment. So the outside environment could really be interpreted as anything. It could be soap bubbles, or it could be another cell that it wants to infect. And by day 8, I was nearing a deadline, so I had to make this quick. But on day 8, I wanted to look again at the spike protein and think about how the spike protein might be laying on the surface of the virus, and the spike protein viewed from perhaps a different perspective. And I decided to finish this entire series with a small throwback to how the pandemic took over the world as a shared human experience. And by the time I reached this artwork, I was thoroughly entertained by my own creation. My spirits were up. I was completely amused by partaking in this project. And I had begun to see and process information about COVID in a completely different way. If I might add, even a more objective way. And to really celebrate the occasion of completing my personal project and going out with a bang, I decided to make a dance mix out of it. And that goes on for 3 more minutes. And I have to say, when the pandemic is over, I think this would be the perfect dance mix to play at all the clubs. And so once I had finished this entire series, to be honest, I was very hesitant to release the series out into the world. I wasn't sure if it's okay or even acceptable to represent something that has caused so much pain and suffering and continues to cause so much human suffering and even death in these bright colors and these vibrant colors and uplifting visual tone. But then I thought to myself that just the process of creating this artwork, it improved my mental health considerably, and it really helped me cope better with the pandemic and all the ideas that were related to it. It almost helped me process the entire pandemic with a new frame of reference. And I thought to myself, really, perhaps if it does that to even another person in the world, I guess that is worth it. And maybe that is what we need going forward. Maybe just like how we need vaccines to protect our bodies, perhaps we need visuals and certain visual communications to protect and heal our state of mind. In any case, I did go on to release the personal art project, and I was very happy to realize that every single time I would present this series to people, or I would talk about this series, there was a very consistent reaction among the audience. There was surprise, there was amusement, there was always some amount of curiosity on what the visuals actually represent. People were in general quite entertained, and almost everyone had the intent to look closer. And I would think that if you want me to distill the communication strategy that played out in this entire art series, it did use a different approach in the way that it used the power of art to almost communicate feelings and emotions. And art is powerful that way because it is almost universally relatable beyond the boundaries of language. And so this is a very powerful way to connect with audiences from all over the world. I also feel that not every scientific communication needs to be informational. Maybe it would be interesting to have a whole new class of scientific communications whose sole purpose is to generate curiosity and interest before we even begin the important part of knowledge and information transfer. And so what did I learn from doing this entire series? I did learn that learning seems to be more efficient when it's motivated by curiosity and not fear. And if society is afraid of science, cannot access it, cannot understand it, or cannot feel like they trust it, then we are letting down those very people that we serve and exist for. Communications need to capture attention, elicit feelings to generate empathy and hold interest. And I would really think that entertainment, curiosity, and novelty are powerful motivators for capturing and retaining attention. And for some anecdotal evidence of that, you have to look no further than Netflix and how the whole world is addicted to it. And with that, I would like to leave you with the next artwork in this series that was requested by BBC. And if you would like to know more about me or my work or the work we do at Sci-Illustrate, please visit us at sciillustrate.com. And until then, and beyond this pandemic, I do hope that you all continue being curious and keep learning and continue being inspired by the beauty and complexity of science. I thank you all for your time, and I look forward to the rest of the session.
Great. Thank you very much, Radhika. Really, really beautiful work that you've done. And I love to see art and science come together. It's such a usually divergent areas, and it's so beautiful when it comes together. And it's really nice to also hear how therapeutic it was. It sounds as though for you to do your art during COVID-19. So
Thank you.
We're going to move on with our next set of presenters, and we'll come back to Radhika and her science in addition to the other presenters in a discussion session in a couple of minutes. So I'm now going to turn it over to our next two presenters, Dr. Malia Jones, who's a researcher for the University of Wisconsin-Madison's Applied Population Laboratory, and also Dr. Lindsay Lineager, who's a public health specialist or scientist at Tuck School of Business. They're both founding members of Dear Pandemic. Dear Pandemic is run by an all-female team of what they call, quote, nerdy girls, unquote, which actually sounds like a really great team of scientists, all female. And they run Dear Pandemic as a science communication campaign, which garnered more than 125K social media followers. So we're going to hear from them in their presentation, Dear Pandemic, an authentic dialogue between scientists and the public as a strategy to address the COVID-19 infodemic. Malia and Lindsay, thank you.
Thank you so much, Melinda, for having us this morning, or afternoon, or evening, or whatever it is where you are. I am going to share my screen. Hopefully you can see that. And we're going to talk today about the origins and lessons learned in Dear Pandemic, as well as some of the strategies that we've used to communicate on social media over the course of these last 15 months. I'll start with a brief intro. My name is Malia Jones. I'm the co-founder and editor-in-chief at Dear Pandemic. And Dear Pandemic is an educational campaign curating timely and trustworthy information about the pandemic, primarily on social media. And I'll be talking today alongside my colleague, Dr. Lizz Leininger. So I will start at the beginning. Oops, I lost the part of my screen that advances slides. Here we go. I will start at the beginning, how it all started. So I'm an infectious disease epidemiologist. I work as an academic at a university, and my work really aims to understand spatial and network aspects of herd immunity and vaccine hesitancy. So I was working in this kind of adjacent space. Early in 2020, I had been watching the emerging situation really closely. And on March 4th, 2020, the CDC relaxed the case definition of COVID-19 to include anyone with symptoms, not just the people who had traveled to one of the early outbreak regions. And this was really a clear signal that we were seeing sustained community spread, or that is to say that the pandemic had reached the United States. And so I woke up the next morning and sent an email to my friends and family offering my perspective on the situation. That email went viral, first in my email and then on social media. And I was soon overwhelmed by questions, many of them very specific, practical, daily life questions about how we were supposed to stay safe in this very uncertain situation. In this state of overwhelm, I reached out to some of my friends and colleagues in my own network, including Alison Buttenheim, Lizz Leininger, Jennifer Dowd, and other academics who were already out there, mostly on social media, trying to help others navigate the pandemic. And we formed this collaborative that became the Dear Pandemic campaign. Our mission is to educate and empower people to navigate the overwhelming amount of information circulating during the COVID-19 pandemic. And that is to say, to help people cope with the infodemic. We are a collaborative of more than 25 women from many different scientific areas of expertise and some non-scientists, including clinicians, researchers, epidemiologists, gerontologists. We have family medicine, mental health, economics, graphic design, and many more other areas of expertise. And we call ourselves those nerdy girls. Our aims are we have two aims, and they are to disseminate trustworthy, comprehensive, and timely scientific content about the pandemic to lay audiences via social media. And second, to promote media and science literacy, which equips our readers to better manage the COVID-19 infodemic within their own networks. So we have some of our content which actually promotes better scientific literacy skills. And we do this by posting easy to understand interpretations of the latest COVID-19 news, with a strong emphasis on the practical aspects of living in a pandemic. Our readers are interested in basic science, but what they really care about is practicalities. That is to say, how does this new information change what I should do now? How does uncertainty inform my behaviors? We do this in English and Spanish via Facebook, Twitter, Instagram, a newsletter, and a website. And we have so far posted well over 1,000 short essays since we launched on March 13th last year. We have grown a community of more than 150,000 regular readers who trust us to provide current, honest, and transparent pandemic-related information that they can really use. We've also done a lot of interviews with news media, served on advisory committees, and given talks everywhere from 6th grade classrooms to the United States Congress. And now I can count WHO in that illustrious list. And importantly, we have had the unbelievable privilege of helping our community stay safe and stay sane. They trust us, and we don't take that trust for granted. I will return to that theme in just a minute. But first, I'm going to turn it over to Lindsay, who is going to talk about some of the framework that we use to do our work.
Thanks, Malia. So like all startups, this campaign, we've often felt like we are flying the plane while we're building it. So we fumbled our way forward, and we've built towards something that we think is pretty engaging and exciting. And it's a learning community. So we wanted to share out some of the best practices and the communication framework that we've built towards. And I just want to say that really we offer this framework to the audience here in recognition that this and our story is not about Malia, it's not about me, it's not about the individual nerdy girls, it's about the power of the army of nerdy girls and nerdy boys who have taken the call, have stood up, have gone and provided credible, relatable information throughout this pandemic to their communities, often without pay and much recognition. So this is in the spirit of the army of nerdy girls and guys and everyone in between, our framework. And I think what it does for today's audience is really summarize and synthesize some of the great themes that we've heard from Melinda, from Lizz, from Dr. Mike. And I'm really excited because I think that this is a synthesis of a lot of what this conference is about. So without further ado, Malia, may I have the next slide, please? So taking a page out of my social marketing colleagues' playbook, we call this the Let's Learn framework. So we have a mnemonic for it, Let's Learn. We'll go through each letter in turn, and then I'm going to show you a few examples that hopefully will help ground what we're talking about. So the L in Let's Learn, the first L is listen and connect. And this has been a key theme we've heard over and over again this morning or afternoon, depending on where you are. People need to feel heard before their ears are open to listen. Two-way dialogue is the best. We know this. This is a longstanding communication principle, and we lead with humanity and humility. Again, echoing things that we heard from Dr. Mike. You cannot fake it. Authenticity is key. So we try to be our authentic selves to the best of our ability, and we listen with empathy. E, we engage the relevant information ecosystem. We all know, everyone on this, in the audience, on the panel, knows how fragmented trust is in the digital age. And so we are humble enough to know that we are not the right messenger for everyone everywhere. So it's been really key for us to partner. And this came up, Liz talked about partnerships. And I think that this is so true anywhere, wherever your place is in the information ecosystem, finding the partners to scale your message is really key. To ground this in an example, I currently live in a politically quite liberal part of the United States. I grew up in a politically conservative and socially conservative part of the United States. And so I have tried to be a bridge, finding messengers back home who I can amplify and support, knowing that that's going to be the right messenger for folks back home, as opposed to folks in my current circles where I live now. Transparency first. It is non-negotiable, especially against the backdrop of uncertainty. And I really liked Melinda's characterization of the WHO principles. Say what you know, say what you don't know, say what you're doing about it. We very much abide by that. And transparency really is the best medicine, indeed the only medicine, to communicate about a changing science. Science is a method, not a fixed set of facts. We are very open about how knowledge evolves. And when we mess up, we fess up because we've messed up. S, we source and vet data from the best. We all strive to be open, humble, and voracious learners. And this is part of leading with humanity and humility. We think it's important for those in our learning community to see us as learners, not quote unquote, sort of experts with a lot of hubris. So we try to model the behavior of learning and being open because it's key for all of us. And last but not least, our tactics are really informed by learning science. And it's interesting because we've now heard about the power of visual imagery. We've heard about all sorts of different tactics. And I think that what I love about this conference is that we have people coming from all the different behavioral sciences, from journalists to illustrators. We've talked about marketing principles. I am an educator by trade. That is my primary professional identity, really. And so learning science is what guides me. But all of the behavioral sciences and cognitive sciences, you're going to see these themes. So I'm going to give you 4 examples that, again, I think are just a nice summary and synthesis of what all the panelists have been doing. First, the power of a worked example. Those of us who are classroom teachers know abstractions don't work. Our brains don't like abstraction, they like examples. So this is the post Malia wrote on evidence-based debunking of conspiracy theories. She actually wrote out a conversation with someone's uncle who believed a conspiracy theory. And she wrote it out with empathy, leading with empathy, providing a fact, ending with empathy. But she wrote it out as an example. And I think that that's really key. Next one. The power of imagery. And I think, Dr. Patnala's, her presentation was just such a stellar example of this. And our brains really do better with visuals. We process them faster, they are more appealing, they grab our attention. So while we are primarily a team of volunteers, the money we have been able to raise, we have put towards graphic design. And specifically an award-winning graphic designer who has worked with scientists in the past. And so our look and feel is very intentionally visual. Next slide. The power of storytelling. And I think this just comes up over and over again, whether we're hearing about Lizz's efforts in Africa or visual storytelling, or Dr. Mike telling stories on YouTube. Stories are psychologically privileged in our brains. That's just a piece of evolutionary psychology. So something that Malia has done a really wonderful job is telling our stories to our community. So every time we tell our stories as people, and this is an example of a story that Malia wrote about one of our scientist contributors, it makes us feel connected and it really sticks in the brain. We love analogies. Analogies, we know, again, from learning science, from marketing, whatever behavioral discipline you're interested in, analogies help us compare and contrast, which is the way that brains learn best. So this is a post that I wrote back when we were first getting whiffs that Pfizer's vaccine candidate was flying through clinical trials with success that none of us in the scientific or medical communities anticipated. My husband, my son, they're big baseball junkies. So I used a baseball analogy to talk about training camp and Pfizer's first round draft pick being successful. Next slide. Last but not least, in terms of learning science tactics, again, hearkening back to what I said before, we know our brains hate complexity. They don't do well with abstraction, especially against a psychological backdrop of anxiety, like there is in a health emergency. So there is a learning science principle. You see it in marketing. Lizz brought it up when she talked about simplicity of messages that they've used, the rule of threes. So this is a teaching framework I've used for lots of different types of students across the healthcare sector. When we vet clinical trial data, we use what's called a 3 C's framework: comparative control, the role of chance, the role of context. So the scientists in this group are going to recognize these as internal validity, statistical precision, and external validity. But the communicators in this group are going to know you throw those phrases at people, they're going to be like, oh, what are you talking about? So rule of threes, the 3 C's, that's how we've talked about clinical trial data throughout. Malia, I'm going to kick it back over to you.
Thanks so much, Lindsay. So this theme has come up quite a few times already, and I just want to return to it. Why did Dear Pandemic take off the way it did? Why did my original email go viral in the way that it did? I think it happened because trust is everything in communications. And right now, as Lindsay said, trust is highly fractured. People don't know who to trust. And people trusted and shared my personal message because it was personal. It was a story, it was practical, and it filled a void. It answered questions that were outstanding right in that moment. Dr. Mike also talked about the role of trust and the power of the share button, and I'm going to reiterate some of those themes in this last segment. Trust is bigger than truth. Trust in the messenger is even more important than the actual content of the information. And the degree to which we trust a message and adapt our behavior is so important. It's even more important than the content, than the facts. which is to say trust can literally defy reasonable thinking. We saw this very clearly illustrated over the course of the past 16 months as trust became fractured by political contexts and basic public health became political. Things like wearing a mask have become signals of political stance. We're hearing now here in Wisconsin that when doctors raise the idea of vaccination in a clinical setting, their patients say, I don't want to talk about politics. And that really speaks to how fractured trust has become. As human beings and social creatures, we trust personal stories, we trust people we know, and we trust relatable strangers. And because we trust our friend and the people in our social networks, we tend to believe them when they share things on social media, even more so than experts. So this is where the challenge of social media and the infodemic comes in. On social media, the share button can turn disinformation, which is information that's purposely developed to deceive and to exploit these psychological factors that lead us to trust personal stories and relatable information. The share button turns that information into misinformation. Trust is central to the problem of the infodemic and also really central to its solution, I think. Dear Pandemic's success at building trust comes directly from that Let's Learn framework that Lindsay presented. We listen, we engage, we admit when we're wrong, and we are committed to using the best sources. And I want to say that we did not come to the project of Dear Pandemic already having that Let's Learn framework in mind. We really did evolve this as we were going, and Let's Learn is the outcome of what we've done over the last 16 months. So we do this on social media, we listen, we engage, we admit when we're wrong, we get personal, we tell our own stories. And we do it on social media because that's where trust networks are so influential and where the information that flows through them is so unchecked. So I think our real service, I often reflect on this, is that we provide content that our readers can share with confidence. And when someone shares our posts, they become a node of trusted information within their own networks. And in that way, we disseminate our scientifically grounded information further. Our audience is 90% women. And many of our readers are also moms, partners, clinicians, or other people in care roles. And what we offer to those readers in particular is a path to reduce the tremendous cognitive burden that was imposed by the pandemic. These folks are in the position of making all the tiny daily life decisions to keep their families safe. And there's a lot of cognitive burden in between recommendation, for example, to wear a mask and the actual practice of purchasing, storing, keeping clean, and getting your 4-year-old to wear a mask. We offer these folks a lifeline when they're swimming in information and don't know what is trustworthy and what is not. So I'll close with some lessons learned. We have 3 big takeaways from our work fighting the infodemic on social media these last 16 months. The first is that trust really is our currency. The second is to fight the infodemic on its own turf, which is social media. We're drowning in too much information in large part because there is so much information flow on social media. And the third is to be really specific, concrete, and practical in the information that we share. People respond very well to content that is usable immediately by them. So I'll end with the question that we get asked the most these days. What does the post-pandemic future hold for Dear Pandemic? We will continue on with our mission to help people cope with confusing health headlines and fighting the spread of misinformation online. That work won't end, and we expect it to evolve. And just as important, we will remain fierce advocates for fellow women in science and women everywhere, and continue to cheerlead for nerdy girls all around the world. So thank you for joining us today.
Thank you, Lindsay, and thank you, Malia. Really, as a nerdy girl, I appreciate your advocacy for the rest of us out there. You touched on cognitive burden of all of the information that's been going around in the infodemic for COVID-19. And I think it's probably led to a lot of mental health issues for many people, which is leading us to our next set of presenters. We're going to hear from the mental health support area of the COVID-19 pandemic. They'll do a joint presentation called "The Story of the Children's Storybook for COVID-19." We're going to hear from Dr. Fahmi Hanna, who's a psychiatrist by training and has more than 18 years of experience in mental health services and in development in low and middle income settings. He served mainly in the World Health Organization at various duty stations and is here now working at our headquarters. Dr. Hanna is the focal point, technical focal point for mental health and psychosocial support for the COVID-19 pandemic. We'll also hear his co-presenter is Anne Wilhoit, who is a mental health and psychosocial support specialist and the lead in the child protection team at UNICEF in New York City. She has more than 15 years of experience working in this area and global development and humanitarian emergencies. She's worked for organizations like USAID and been an advisor for the World Bank and the World Health Organization, and she's overseen mental health and psychosocial support services in Asia, Africa, Middle East, and Eastern Europe. So Fahmi and Anne, thank you.
Linda, thank you so much for this wonderful opportunity. It's a great pleasure and an honor to be here at the closing ceremony presenting about this project. Colleagues, I shared here in the chat functions 3 hyperlinks. One of them is all the translations of this children's storybook. The second link include all the multimedia adaptations of the children's storybook. And the third link include a highlights report that we released after 1 year of dissemination of the children's storybook. So please feel free to go through those links and use and disseminate these resources as relevant to the languages of the countries you are operating in. But let me start with my presentation now, telling you about the story of the children's storybook. Sarah's mom is her hero because she is the best mom and the best scientist in the world. But even Sarah's mom cannot find a cure for the coronavirus. Colleagues, this is how My Hero Is You has started. This is page 1 of the children's storybook, telling us the story of a child who is 8 years old, who wake up on a very different world, and then met an imaginary character and start traveling around the world, meeting families, meeting children, and learning together with them, with the imaginary character, how to cope with emotional stressors related to COVID-19, focusing mainly on our target audience for this product, children from 6 to 11 years old. I'll step back here and talk to you about who developed the storybook. The storybook was developed by the Interagency Standing Committee Reference Group on Mental Health and Psychosocial Support in Emergency Settings. This group chairing function is rotatory. Currently, it is co-chaired by the International Federation for Red Cross and Red Crescent Societies. We have online my colleague Carmen from the IFRC, who is co-chairing, and myself from WHO, who represent WHO as co-chair of this group. But we have members from all United Nations agencies and international NGOs who are active in the area of mental health and psychosocial support. The key role of the group is to mainstream mental health and psychosocial support within the humanitarian system and to support country-level mental health and psychosocial support technical working groups through development of normative guidance as well as operational support. And the group exists since 2007. It's very important to mention that the guidelines, the theoretical and conceptual knowledge do exist for this group since 15 years. And also the group has developed numerous documents translated into many languages, including the ICMHPCS guidelines, which is the basis for any product we develop, and many tools, including guidance on referral, guidance for Ebola, guidance for H1N1, that were all instrumental and help us to not start from scratch while we are developing guidance for COVID-19. Again, as part of my stepping back, the overall work of the group on COVID-19 started actually as early as January 2020 by coordination calls. Through one of these coordination calls among the 60 member agencies, among the United Nations and international NGOs, we know that we need to develop guidance for COVID-19, including guidance for children. Very early in February, we developed guidance with recommended actions for families, for children, and basically it was about key messages. But we knew that there is need to do more. This guidance the uptake was big, 24 languages translations. We developed also guidance for COVID-19 frontline responders in an innovative way, a comic book. We developed guidance for older adults released very recently in the form of posters designed based on the famous Where is Wally series, giving messages of coping for older adults and their caregivers. As you see, all these documents, the uptake was 20 translations, 30 translations, really, really huge uptake. But the one which really went far beyond anyone has imagined when we start working on that was My Hero Is You, the children's storybook for children aged 6 to 11. It is available now in 143 different languages with 50 plus multimedia adaptation. 143 languages. While we started translating it only, what we did ourselves was translating it only to the 6 UN languages, but all the rest was done by the field. 143 languages make it one of the most translated resources ever produced by the UN, and make it indeed among the one of the most translated books actually ever produced, or children's storybooks ever produced. What makes this product unique, we think, what makes the uptake really great in countries was that we listened to the field. It was not written by a group of experts sitting in headquarters or regional office. It was actually based on a survey that was disseminated through newsletter, widely translated and disseminated. In 3 days, we got the survey filled by 1,700 children, their caregivers, parents, and teachers at the early times of the lockdown in March last year. 1,700 of them from 100 countries has filled the survey in 3 days and provided us with insights about the emotional needs of children, their caregivers, and parents. It was developed in a very clear and very simple format, in an inclusive format. Some of the main characters are migrants and refugees. Some of the main characters are children with physical disabilities. And also the field testing phase helped us a lot in really rephrasing many of the content of the book and adapting it to field need. It was field tested before release in more than 40 different countries. As I mentioned, it's available in 143 languages. And if you zoom in a little bit into the statistics of who actually was doing the adaptations and translations, you will find that, in fact, it's really not the majority of the translation done by United Nations. Although it's a significant portion, but still not the majority is by the United Nations organization. Actually, governments, mainly ministries of education and ministries of health, were requesting from us the translation of this resource. Professional associations played the key role in the translations and adaptations. Universities around the world played a key role. So this pie chart reflects basically a symphony of global coordination and inputs to dissemination of a global resource. You zoom in a little bit what 143 languages mean. 11 different languages from India, local languages in India, in Uganda, 8 local languages, in South Sudan, 4 different local languages, in total 53 indigenous languages, 61 languages from humanitarian settings, and 111 of the translation represent low and middle income countries' languages. But it's interesting to also look that it is available in all European local languages as well. So high-income countries also translated the resource. The difference between translation and adaptation is translation exactly, it is the resource as it is, as we developed in the English version. And we provide support through graphic designer and through a team also of technical staff who support the coordination of translation and review of the resource in local languages. But adaptation means that there was a derivative product that was coming from this resource. And the adaptation were really numerous, from cartoons to theater plays to puppet plays to audio version, huge amount of adaptation. And if you want to look at them, please visit the adaptation pages links that I just shared. One of the remarkable things also about adaptations is that many of the organizations active in the field of disability has adapted it into accessible formats. One of the most early adaptations was actually done by the Zimbabwean Blind Women Trust, group of Zimbabwean blind mother volunteers who wanted to read the story for children. They adapted it in Braille in English, but the same happened in sign language by Humanity and Inclusion in Arabic, sign language in Korea, sign language in Indonesia, and many other. It is available as an audio file for children with visual impairment in 26 different languages. And the uptake was remarkable. If we look at the first 5 months after the release, on one website only, the website of UCHA, the English version only, not all the 143 language, 350,000 downloads of the English version only on one website. The adaptation, 2.5 million views of a Stanford medicine adaptation where they took the story and turned it into a cartoon, conveying the educational messages without words so that it can be adapted easily for children with sensory impairments. And it was released with 2.5 million views so far in this adaptation by Stanford Medicine. But not only that, there was another adaptation also that was very successful, done by WHO in Philippines in collaboration with WHO in Mongolia, in another cartoon film for the local context, adapted by both countries, 350 plus views. Korean Psychological Association adaptation has been viewed more than 200,000 times. And all these are examples. If you want to go more in depth into translations and adaptations, please read the dissemination report I just shared. One of the key contributing factors to the wide dissemination and this reach of the children's storybook was actually related to the day of its release, when WHO communication colleagues played a key role, but not alone. What was beautiful is that you see here the images from the UNICEF main page on 9th of April, UNHCR main page on 9th of April, UNESCO main page on 9th of April, as well as WHO page on 9th of April. On the same day, the top news on 9th of April was the image of Aryu, the main imaginary character. When we sent the document for clearance, we found that there was quotes from heads of agencies of all these agencies, so communication officers from all these agencies wrote press release. And when you join forces, the uptake is remarkable. We saw that on the same day, CNN was reporting 2-3 times about this resource, Forbes, New York Times, BBC World News, local CNN and BBC in many countries, and Le Pais, Le Monde, Masrawi, Al Jazeera, World Economic Forum, huge amount of uptake. We counted them at one time. I think they exceeded on the first week more than 200 mentioning in key global media around the world. And that helped in dissemination, that helped in the uptake of the resource widely. It was mentioned by the UN Secretary General in his report about mental health in UCHA when they released the Global Humanitarian Response Plan, and during the World Health Assembly discussions as a story of global success. This is a map of the world. All what you see in orange are countries where we have the storybook available in the official language of the country. It is available in 87% of the UN member states, 100% of official languages. You see what we put in green, for example, in Bolivia, because Bolivia have many official languages, while we have 3 of them included in the translation, but we have not covered all what Bolivia report as official languages to the UN. In this image, you see many smiling faces for users, readers of the book around the world. From Japan, when it was disseminated by the CDC Japan, from Suriname when it was disseminated by the Ministry of Education to all schools, by the Zimbabwean Blind Women Trust in Braille version, and in Ukraine you see the clay animation, and the Johns Hopkins Center for Indian American Studies has adapted this version you see on the top left side for Native American, with complete readaptation of all the images through intertribal workshop, where it was disseminated to more than 85% of healthcare facilities providing services to Native Americans, both in USA and in Canada. All this again are examples. The uptake has been huge. I hand over here to my good colleague Anne from UNICEF to take over from this point.
Thank you so much, Fahmi. And you know, we wanted to show you these pictures, especially because we really are truly inspired by the children in these photos, and also what it represents, especially if we think of what they're each individually working through and processing the weight on their small shoulders throughout this pandemic. So quickly, another example I wanted to show you is the very bottom middle there, where UNICEF distributed 37,000 copies of My Hero Is You to primary schools in Thailand. Here, they did an interesting side project adaptation, as Fahmi was mentioning, called Readers Theater, where you can see the girls lined up there with hats on. And what they did was the high school students put together a performance of My Hero Is You and performed it to the younger students nearby primary schools. So it gave the older students an opportunity to still engage with the concepts around talking about coronavirus while also supporting and engaging the younger children simultaneously. So I think we'll just move on to the next slide, but wanted to just emphasize the individual nature of the children and the work they're doing as well. Next slide. Thanks. So part of this engagement around the story we found to be especially important. And so we wanted to emphasize that more and give people tools for engaging students and children around the ideas in the book. We created a resource called Actions for Heroes with these ideas in mind. So Actions for Heroes is an accompaniment to My Hero Is You that was developed to support caregivers and teachers reading My Hero Is You with children. So it's also developed through a very comprehensive consultation and field testing process among the Interagency Standing Committee, MHPSS reference group, and countries who are already using My Hero Is You. The idea is that it offers guidance, which is indicated by icons throughout the book, on how to have honest, supportive, heart-to-heart chats with children about the pandemic via the story. There's overall guidance on supporting the children, sample scripts for interactions with the kids, and then separate pages that are for adults only, which includes guidance for themselves as caregivers throughout the pandemic. So it explains how adults can create safe spaces for children to openly share their feelings and include their fears and worries about the coronavirus and frustrations at their changed daily lives. And that it also directs adults on how to promote positive actions that children can take to protect themselves and others. This is currently translated into 11 languages and 10 more are currently ongoing. Next slide. So it's been 1 year since the storybook was released, and now we're also in process of developing a second book to address the concerns of children during the current phase of the pandemic, to help children and their caregivers and teachers cope returning to school and as the pandemic continues to affect us all. It also has been really a truly collaborative effort, including WHO, UNICEF, OCHA, Save the Children, and many others. So as a first step, again, we're seeking feedback from children, their parents, and other caregivers and teachers through an iterative and participatory process. Just to note, the first step being the survey. The first survey that Fahmi mentioned before for the first book had 1,700 responses, which at the time we were just overwhelmed with. Now this time around, we already have 2,000 responses to the survey before even starting the pilot. And because also the first version was so successful, the main site of OCHA and the main site of Relief Web has featured the survey for the second version to support the work. And I'll drop that link into the chat in a minute. And so why do we feel that a second version is so important? The first version was created very early in the pandemic while almost all children were out of school. Now kids are returning to school, but the pandemic still continues. COVID has made the world into a very different place than when the book was first written over a year ago. And the need to continue the story and address these different challenges was clear in calls from parents and caregivers, children and teachers. Especially around issues, you can see in the right there are some quotes from people who were asking for a second iteration. true around returning to school, family pressures because of the pandemic, economic impacts, and just the sheer length of the pandemic. So just to go through quickly the development process now, the current development process for the next edition of My Hero Is You includes qualitative targeted surveys and focus group discussions, qualitative global surveys, and pilot testing. So the qualitative surveys are targeting the UK, Japan, Indonesia, Singapore, Nigeria, Portugal, Brazil, Northwest Syria, Mozambique, and Greece. And we are making sure to have it inclusive of children with disabilities and noted in the locations, children living in humanitarian settings. So here you can see in the top photo, children participating in a focus group discussion in Northwest Syria. The quantitative global surveys are still open and are available in 9 languages. And then the pilot testing of draft versions are simultaneously happening with the global surveys in Myanmar, Ukraine, Nigeria, Turkey, Portugal, Brazil, Philippines, Venezuela, and Fiji. And here you can see in the bottom right photo of a young girl in the Philippines participating in a pilot test of a draft version via her computer. I don't know if you're able to see if it's too small, but a WHO worker is on the screen reading this draft of the storybook to the children for the pilot test. And so finally, we hope you'll interact with our story and can contribute to its success yourself. As I said, the global surveys to understand the stressors and coping method of families and children in the current context are still open. If you're a caregiver, please do participate in the survey through the link here on the screen, and we can also drop that in the chat if that is easier. The launch for the new story is planned for Q3 of this year, and we look forward to your continued engagement to ensure mental health and psychosocial support for children as our whole world endeavors to overcome this pandemic and deal with these continuing impacts on mental health and psychosocial well-being. Thank you so much.
Thanks so much, Anne and Fahmi. It's really nice to hear the whole story of the story as it unfolded. I can distinctly remember when we reviewed the original book. I think it must have been like last spring. So it's really nice to see how it's evolved from that. Thank you very much for your presentation. Such an important project. So we're going to go to a short discussion between the presenters that have occurred from Radhika to our Dear Pandemic colleagues, and then to you two as well. So my first question, though, is going to go to Radhika. Radhika, in your artwork, your beautiful artwork, you seem to use different colors for different things. It seemed to be more warm colors for healthy cells and maybe cooler colors for showing the COVID-19 disease. Was that on purpose, or just generally, how did you think about the shapes and colors that you used in your artwork?
I mostly took inspiration from creating abstract visuals. So as far as color usage is concerned, colors need the support of other colors to work. So there is no good color or bad color. It just needs the right kind of colors around it to make it do what it needs to do. So in that way, the colors that I used were intentional only to my personal preferences of what I usually like to see, what I usually like to make. And I did not cater it to delineating a good guy or a bad guy in the conversation.
Okay, great. Thank you.
Yeah.
I'll go next to our Dear Pandemic colleagues. What do you think? Is it important really who the communicator is when it comes to trusted information? You described your group as being a large group of nerdy girls, an all-female team. Do you think that was an advantage or a disadvantage in your communications?
I can speak to that first and then turn it over to Lindsay, maybe. I think it's a tremendous advantage. And one of the reasons is that because, when we talk about communicating to the general public, there really is no general public. You have to tailor your communications to a particular audience. And we were able to do that and build the trust that we built by being relatable. And so our team is comprised entirely of women. And between the nearly 30 of us, I haven't added it up recently, but the last time I counted, we had over 40 children between us. And so talking to moms and other care providers during this time was really, we could be very relatable and personal and build that trust that way. And so I think it was an advantage for us. Lindsay, do you have additional thoughts there?
I do, and it's just a story. So here's the thing about those nerdy girls. We did not give ourselves that name. It was given to us. So we happened to be women who came together. In public health, there are a lot of women. This is no secret. And one of our early community members, dealing with the information overwhelm, said, I'm going to tune everybody else out and listen to what those nerdy girls have to say. So the name stuck, and then it became an intentional brand.
Great, that's nice to know. Okay, great. I have another question for you as well, but others can chime in and answer. We talk a lot about trust. I mean, it's sort of the drumbeat of emergency risk communication, communicating clearly to numerous audiences. And we always say it's at the center of everything we do in communication. But we've had some recent discussions here about what the science of trust is. How do you measure that? How do we know what trust is and what it means to different individuals? Do you have a perspective on that? And then I'll go to Fahmi and Anne to hear that answer as well. But Lindsay, please go ahead and answer first.
I don't know. Honest. I mean, just honest. But I think that's part of the reckoning we're all going to have after this pandemic. We need better measures of trust. I'm a measure developer for healthcare safety net issues. So it's on my mind. I don't know.
We see it when people share our content, right? It's sort of manifest. And I think that's part of what the share says, is that they have read it and they liked it and they trust it enough to share it. But I agree, we don't really know what its meaning is.
Okay. All righty, and thank you so much. And I'll go to Fahmi and Anne for the last question in your beautiful book. We're curious about why you chose a dragon as the feature character. And we saw that you were doing a lot of pre-testing with children, and it was nice to see that image of the child listening to the story being read by a WHO person. So it was nice to kind of see that pre-testing and the evaluation side as well, which we often kind of miss when it comes to emergencies. So the dragon and what we anticipate from evaluations at the end of this, and maybe any behavioral impact it may have.
And a great question. And if you allow me, happy to answer and hand over to you also to provide your inputs, please.
Just quickly, though, we do need to go to our next
quickly. Okay.
So thank you.
Aryu is not a dragon; it's an Aryu. So Aryu is simply having a unicorn head, an orange color. It's not a dragon. And the original version actually of this is here in the report I just shared, was actually an elephant, and kids did not like it. So we asked kids and we adapted the character. You see also the development of Aryu, and we never called him or it a dragon. So Aryu is not a male or a female, and Aryu is not a dragon. It's an Aryu. And what we learn through the story is that actually Aryu is Sarah. When she asked him how she meet Aryu again, Aryu clearly answers that I'm inside your heart. I'm always with you. So it's not a dragon. It's an imaginary character that was developed through consultative process to the ones that match really with the character. There will be animals in the new version, and to select which animal also is a cultural concept. So we consulted widely in getting inputs, but it could have been anything else. And one stage it was an elephant, which exists here in the report. And please.
Yeah.
Maybe just very quickly, I actually wanted to respond briefly to your previous question to the other presenters on trust. And I think that that's an aspect that mental health messaging has really found to be important as a part of the response to this pandemic is supporting that trust. And I think that's also why there has been the success of this book in terms of getting the trust of the children and the trust of the families in creating the materials, but also just in general, why it's important to incorporate mental health and psychosocial support into all messaging and response in order to have that trust foundation. Thanks.
Great. Thanks, Fahmi, and thanks, Anne. And It's good that you used a mythical character. We're learning that on some other materials. When you use an actual animal, there could be issues. So it's lovely, really nice to see how that product's grown and really had such an impact. So thank you so much. So thank you, Radhika. Thank you, Malia. Thank you, Lindsay. Thank you, Fami. And thank you, Anne, for your time today. Really, really fascinating products and really creative. So nice that you could take the time with us today. Okay, so we're going to move on now to our next panel session, and this is sort of a wrap up of the entire conference that's occurred over the past 3 weeks. We're going to hear from different representatives of the different tracks that we've had throughout the conference. This session is called Using Science Communication to Tackle the COVID-19 Pandemic, Insights from the Thematic Discussion Areas. So first, we're going to hear from Charles Mbekemi, who's from the London School of Economics and Political Science in the UK. And he's going to discuss review one of the discussion thematic areas. So, Charles. Hi.
Yeah. How are you? Thank you for the invitation. So I'm here to present back a little bit of the discussions we had on the research track during the conference. And it was a very fruitful discussion, I think. One of the first things we discussed was really the simple question of whose responsibility is it to communicate science? I think historically, science communication has been seen as the methodology of presenting scientific facts and findings to the general public in a way they can understand, and as well as ensuring that people have sort of access to the right information when needed. And this has slightly evolved today, and because not only do we have the producers of science, we also have users of that same science. And historically, there's been a lot of emphasis has been placed on the producers of science as having the responsibility to communicate that science. So this means scientists and researchers, and this throws up certain challenges. As scientists and researchers in academic roles are often not really rewarded, resourced, or even really supported to do communication in a manner that will be effective. So we talked a lot about that. We talked a lot about how the sort of scientific method and scientific training is slightly in direct conflict with plain language science communication. And this isn't changing, and this is evolving somewhat, but there's still a long way to go. So whose role is it to communicate science? And more, the responsibility of science communication really rests on all parties. So not just scientists, but journalists, other actors. And science communication, the ecosystem, can often be a system with a lot of gatekeepers, and gatekeepers exist really at all levels. But in this new multi-connected world we live in now, this notion of gatekeeping is slightly outdated. Information flows extremely fast, so there's a need to take away the sort of false image of gatekeepers as a sole bringer of sort of science and truth. The issue of whose role it is and gatekeepers plays into how we start to think about trust in science. With the participants in our track, we talked a lot about the challenges in generating trust in science, and have been challenged to make, and the challenges involved in making people trust official sources. And a key part of the conversation was trying to identify who people trust when talking about science. When they talk about science, who do they go to? Is there a hierarchy of information sources depending on who you are? That came out discussion is what came out of the discussion, I think, was a sense that there's more and more there's a collaborative approach to science communication, and that is something that needs to be sort of promoted, supported, and augmented. The discussion and research track, we talked a lot about challenges, and I think one of the challenges at the beginning of the pandemic was that it was new. And lots of information was emerging rapidly. It was often hard to tell what was good information and what was bad information. We discussed a lot about the credibility of sources and trust, who delivers the message, questions of belonging, identity, belief, all factor into the message delivery, and also when the message lands. We talked a lot about maybe we should worry less about people trusting information and work more on making information more trustworthy to overcome some of these issues. And there were some methodological examples in the group which were good to see. So there was this question of quality of information. And so this was the research track, a lot of discussion was also around the role of scientific journals. And during the pandemic, there was a sort of shift. There was an astronomical volume of submissions to scientific journals, many with the low-level evidence, people just sort of making sense of the pandemic as it was happening at the time, and sort of reporting their experiences. and sort of two key trends emerged at the beginning of the pandemic. And one was this use of preprints and sort of ultra fast track timelines, routes to publication. Scientific publications really had to adapt to this new situation just to keep ahead of demand. And this meant logistical challenges with everyone on lockdown. There was sort of challenges in sort of who was doing the work, but this also meant challenges in the peer review process and the scientific scrutiny you sort of normally expect with journals and scientific evidence. Even though there was a sort of explosion of preprint papers, it seemed that the scientific community still appeared to want to perceive the security and quality assurance of peer review. So I think they still demanded that sort of peer review quality assurance in the submission. So things would go onto the preprint server first before that full review. So that was good to see. But however, the rapid nature of this publication process provided some sort of crucial, it provided actually a very crucial service in having the research, the evidence more accessible and digestible, made it more available to people. And one big issue this threw up was a lot more people now, not just scientists, but other people were reading these articles. And because of sort of the differences in the literacy of the scientific method across populations, across people, the sort of unknown sort of black box of the scientific publishing environment, we got into this muddled territory as to what the data actually says, and it's open to interpretation depending on whether you're a journalist or policymaker. And then I think this is the case with all scientific literature before COVID, but the pandemic really highlighted that given this direct line from publication to interpretation to policy use, it started to muddy the waters, and these had real world implications. You can't really take something back that has already gone viral, and there were a few examples of that during the start of the pandemic. I think I can end with some sort of insights and recommendations. I think this wouldn't be a conference without giving some recommendations to the World Health Organization, how they can sort of foster and go forward in this area. When we talk about communication to the general public, it's sort of the general public is no one and everyone. And there are whole processes and translations to be done before the act of science communication happens. Changing science to community guidance requires a lot of framing and narrative, development of key messages adapted to every context in a given community, whether that's sort of social, economic, religious, or everything else. And I think everyone has a specific role to play in this process, from risk communicators to scientists and all the other actors. And they all need to sort of start to engage and talk more with each other. And more with science communication, I think there's this notion of meeting people where they are in how we communicate science. People come with their lived experiences, their biases, their beliefs, ideologies, but also hopes and aspirations. How do you produce a framework of science communication that can account for sort of 7 billion discrete entities and biases on the planet? So I think the WHO can really help in providing a lot of improved coordination in this area. I think that what we see missing is coordination between all the different actors and stakeholders. And so this fosters a little bit of a lack of accountability from all sides. If it is everyone's responsibility to communicate science, then it isn't really anyone's responsibility to get it right or do better. So that was some of the discussion that we had in the group, and looking forward to hearing what comes next. Thank you.
Thank you so much, Charles. It's really insightful, and I was taking notes, being partially responsible for a lot of WHO's communication throughout COVID-19. Your note of communicating to no one, but then everyone is ringing true throughout the past year and a half. Thank you very much. So that was Charles, and Charles reviewed the in-depth conversations that occurred with the research track within the conference. Next, we're going to move over to a different track, which is the media track. And we're going to hear from our colleague, Mohammed El-Sambati, who's the freelance journalist and science communications consultant who is coming to us from Egypt. Mohammed, thank you.
Thank you, Melinda, for the invitation to be here today. So I will be representing the media tracks. We have several discussions over the last 3 weeks about the role of media, science communicator, science journalists during the pandemic situation. So I would like mainly to highlight some of the challenges that we have discussed that facing us as a media professionals or science journalists, starting with like the limitations on the capacity building activities for science journalists and science communicators on various levels. For example, like for science journalists, many of them needed to be informed more about the pandemic, about the statistics, about the epidemiology, about whether to report from preprints or not, and many of these aspects. And also, since there was like a great interest in science journalism, we have seen that many of non-specialized journalists and media professionals try to cover and report science, especially about the pandemic. But in many cases, they lack training on how to report science accurately, successfully, and effectively. Another level is that like most of the training opportunities are already available in English, maybe in French or Spanish, but what about other languages? Even if like the languages that are spoken by a lot of people, like something like Arabic or Russian or Chinese. All of these like show us there was like a really limited capacity building activities on that aspect. Another challenge, which has already existed before the pandemic, that there is like a clear gap. We know that there is already a clear gap between the science and society, and science journalists and media acting as a mediators mainly between science and society, but also there is like more gaps within this kind of context. There are gaps between within journalism and the media communities itself, between science journalists and non-specialized journalists. There are also gaps between the media community and the scientific community, and also the gap between media and policymakers, and the gap between these three actors. So we are moving around a lot of gaps that needed to be bridged somehow, because this affected the reporting and covering of science. Also, during the pandemic, science journalists have faced, let's say, it's a kind of a new situation of dealing with the large amounts of scientific information, also misinformation and disinformation. We have witnessed what was called the infodemic. A lot of information that need to be navigated, evaluated, assessed to decide its quality and which one should be reported or not. A lot of misinformation that needed also to be, and disinformation needed to be debunked. And we have seen many waves of this through the whole pandemic, starting from saying like this is a kind of conspiracy theory, ending with like the safety of vaccinations and what it can do or what it cannot do. All of this was considered to be relatively new and needed to be addressed too. Also, part of the discussions was about like that we need an evidence-based practices. We need more research and evaluation for the interventions and activities approaches, communication approaches done by journalists and media to know what it works and what doesn't work. And we need also to take into consideration the local context, because many of the research that's currently found is coming from like Western countries, that it's not guaranteed that we can extrapolate these results and these approaches to other countries. So the local context is also very, very important. So this is part of the main challenges that we have discussed, but what about the opportunities, or what the next steps that we need to take in order to face these challenges? First of all, like we need more investment in building capacities of science journalism and science communicators. And I speak here that we need more building capacities for journalists, non-specialized journalists, and also for science communicators. The same applies to researchers and scientists. We need to train them more to be able to speak with media and speak with the public in general. And this building capacity should also focus on innovative communication, change behavior approaches, fact-checking, scientific literacy, media literacy, etc. And also, it needed to be done in different language, not exclusively in English or French. Another thing that need to be done is more networking on various levels. Networking within the science journalist community itself between different countries on local and regional levels. networking between journalists and science communicators, because there is a kind of a gap also between these two communities, between science journalists and other media professionals, with researchers and scientists, with policymakers, with other stakeholders. What we can say is that a multi-stakeholder collaboration is essential to overcome what we have witnessed during the pandemic. Also, the infodemic, how to manage an infodemic. It's not only about debunking the misinformation, disinformation that already exists, but we need to do something in advance, which called pre-bunking, is trying to identify the information gaps that are there, that are expected to have misinformation, disinformation about, and start tackling them even before it happens. We have discussed like many examples of these organizations working on infodemic management. And finally, more research and better evaluation of the science journalism and the communication interventions, taking into consideration the local context. And what I would like to say as a final message from science journalists and communicators, media professionals, that we find ourselves that we are prepared usually to the last crisis, trying to adapt with the current crisis. But there is a big question about the next crisis. Are we ready to face this or not? Are we ready to I mean, it's coming anyway. It can be climate change, antibiotic resistance, anything else. We need to be well prepared to the next crisis too. Thank you.
Great. Thank you so much, Mohammed. Very insightful discussion. It sounds like that you had in the media track and a lot of work to be done. We really count on journalists as being one of the primary sort of trusted information channels to our population. So it's very important work that needs to continue to happen in that field. So thank you very much for your observations. So we'll move now to the next track, and that was where we put science into action. And there were two sub-tracks in this area. One was on health education and cultural professionals. So we're going to hear from Francesca Hartley, who's an intensive care nurse at Nottingham University Hospitals in the United Kingdom. Francesca, thank you.
Thank you for the introduction, Melinda. Hello and good afternoon, everyone. I am here today representing a group of working professionals from health, education and cultural sectors. We came together over the course of this conference to discuss our experiences with COVID, but also the challenges we face as our day jobs evolved alongside the pandemic to take on the new role of science communicators. So we were brought together by a joint goal of learning how we can improve our science communication. So we did this by discussing cross-sector examples of how we've each responded to the demands of COVID in our respective industries. And then we delved into the effectiveness of various communication tools that we have used. We then drew some recommendations for how we think we can be better supported in our day jobs to improve our communication of COVID moving forward, but also how we can develop some preparedness for future health emergencies. And I'll share with you now some of our thoughts. So through our discussions, it really became clear that the issue of misinformation has been and continues to be a huge barrier to ensuring all our consumers remain safe and informed in all of our roles, whether that be in tourism, humanitarianism, popular science, or healthcare. We all know that we live in an age of social media where people have an instant access to a myriad of information at the click of a button, regardless of the provenance. And this exacerbates the asymmetry between the speed of science and the spread of the information. And we found that this made it particularly challenging for us to develop meaningful content that breaks through the background noise. But not only this, the misinformation breeds a hostile environment which disarms our communication. When emotions are high and cloud judgment, the capacity of an individual to take on new information is limited and can result in misunderstanding of the situation. But equally, we also found that controversial topics, regardless of their sentiment, can cause anger and conflict rather than reasoned debate and positive action. So then we thought about discussing the importance of priming our audiences with long-standing, trusted relationships and ensuring the right audience, right place, right time, right message to allow the recipient to be receptive to accurate messaging during times of crisis. So using these principles, we hope that perhaps we can provide a useful narrative that reaches our audience, that cuts through the noise in what's already a saturated space, and get our audience to action appropriately. We also discussed how mistrust and hesitancy is present among minority groups. In part, we decided due to some countries and institutes adopting a paternalistic style of communication, where the information given is not tailored to the consumer needs. So we feel that if we include all minority groups in the conversation about science moving forward, it's really important that we start to open up a two-way discussion between the consumers and the knowledge providers. Consumers are more likely to adopt the science if it's tailored and relatable and tangible to their lives. Another difficulty faced by this minority group is the rise of technical jargon in relation to COVID. And I know we've previously discussed this with previous speakers, but this jargon doesn't necessarily translate into some languages. And therefore this calls for a language in which we describe the pandemic, to describe a global plain language glossary in order to include everyone in the conversations that we're having. We also discussed how these minority groups' access to basic resources is a real barrier to their health. So we believe that we need to continue to collaborate with local leaders who can translate the information in a culturally appropriate manner, which is essential to reach these marginalised groups. Given these discussions, we summarise the next steps that we believe will help us in our day jobs to communicate science as we move forward with COVID, but also to prepare for future health emergencies. So we decided that to remedy the disparity between the spread of information and the speed of science, we call for a greater understanding of how science works. So for us, we thought this introducing science and critical thinking into school curriculums early in children's education will harness an awareness of scientific process and rigor and foster the ability to make reasoned and considered decisions. A skill that will also help combat misinformation by ensuring the individuals are equipped with the skills to identify and evaluate credible sources of information. We also call for the adoption of a two-way conversation. We believe a shift away from the paternalistic styles of communication will engage those who are either marginalised or not actively participating in the COVID-19 pandemic rhetoric. The use of a two-way conversation will reduce the amount of noise in the public domain, make it easier for audiences who are searching for the answers, as well as making it easier for us to publish information that is useful, relatable, and of greater impact. So through these discussions, it became clear to us that science communication is an integral part of our daily life and will continue to be so for the foreseeable future. Therefore, as a group, we thought it was worth investing the time and resources into ensuring that we are equipped to take on this new role as science communicators. Thank you, Melinda.
Great. Thank you so much, Francesca. I really appreciate it. I trust that your day job is quite busy. So I really appreciate your time and your energy on this. And it's nice to see these areas come together and talk about science communication and your role, your important role in that area. So thank you so much. We're going to shift it now to the final group in the tracks that we discussed during the conference. And this is with Miriam Jenny, who's the head of the Science Communication Unit at the Robert Koch Institute. She's going to talk about the results from the track that was really focused on decision makers. This is typically the group that the World Health Organization works with for scientific communication. We work with decision makers at country levels, particularly for emergencies. So it'll be interesting to see what your discussion came to. Thank you, Miriam.
So there I am. Thank you very much.
There you are.
So I will focus on insights that were shared by many of the participants in the decision makers track, or that surprised me personally. And I will then close on a note that we didn't discuss in great detail, but that I personally think we need to urgently address. It does pertain to trust, which we have heard a lot about today, but with a different spin. So what are the main goals of science communication efforts? Beyond conveying scientific facts and methods, our communication should foster critical thinking and improve scientific and risk literacy. So science communication should boost people's competencies and thereby help them make good and informed decisions on their own. So during the COVID-19 pandemic, science communicators experienced many challenges. We often failed to engage with migrant or other non-majority communities. We struggled with the politicization of scientific knowledge, struggled to communicate through the noise produced in this fast-paced infodemic, to adjust the bar of expectations for science, to produce black or white answers, to counter false information, false balance in reporting, and pseudo-experts. I think we all realize that most citizens, including high-level senior decision makers, were unprepared to suddenly be confronted with more detailed aspects of scientific methods and tools. So for example, only few could really differentiate between model predictions and scenarios, and many lack basic scientific literacy. While this paints a bit of a bleak picture, we all learned a lot. We enjoyed a heightened public interest in science and could make use of new and evolving ways to communicate science, including TikTok, blogs, and podcasts, as well as the joining of forces between journalists, scientists, science communicators, influencers, activists, and the public. And we can build on all of this. So we have to keep in mind that public discourse shapes political decisions. This is one reason why the media play a big role in science communication. To get science to policy, we also need to get science to the public, so to the voters. And different stakeholders, including different segments of the public, vary in their informational needs as well as capacities. A bite, snack, meal approach can help balance between clear and simple messaging and having substance. So start with the main facts, put simply, the bite, offer some more depth and background, the snack, to a more involved audience, and provide the whole package, including references to original research, to those who are hungry for the whole meal. Let me spend the last minutes on trust. We cannot just build trust. We need to signal trustworthiness. We need to be trustworthy. In her opening keynote at the beginning of this conference, Alex Freeman discussed research that shows that communicating uncertainty and risk estimates does actually not harm trust. It is challenging to explain uncertainty, though, so we need to find better ways to convey risk and uncertainties around estimates. We also need to be transparent. The public should know who advises the government, how and when, and on what topics. Scientific advisory boards need to be diverse, so people perceive them as legitimate. And when we communicate science as the solution to many of our global and local challenges, we need to do a better job at communicating the broad influences that our discoveries have had from many cultures, not just from the current mainstream. We hear a lot about the European contributions to medicine and science, so Edward Jenner and James Lind, but nothing or very little about the contributions of other cultures. So for example, did you know that Lind based his work on the principles of how to conduct clinical trials developed by the 10th century Muslim scholar Ibn Sina? During the group discussions, Shamila Anwar highlighted that mentioning a community's contribution to scientific facts can improve acceptance of health policies. Thus, science communicators should collaborate more with historians of science. And when we engage with communities, especially those who distrust the government, we have to communicate that we are engaging in the hope to make positive change. We can tell our past success stories of how things improved, and we should make those publicly available. But now comes the hardest bit. We also need to acknowledge past failings, especially to communities who have been harmed in the past. As science communicators, it is not our role to defend the government or to wipe away errors. We can only bring about positive change if we acknowledge the past mistakes and learn from them. In the beginning of the COVID-19 pandemic, a statement by Mike Ryan went viral. In that video, he said that in today's culture, everyone is afraid of making a mistake. everyone is afraid of the consequence of error. This fear has not only slowed down emergency response, it also prevents us from acknowledging and owning our past mistakes and learning from them. So how can we acknowledge past mistakes, especially those made during the pandemic, when decision makers are afraid to be blamed for errors in post-pandemic lessons learned processes? How can we best communicate that we have learned from our mistakes and how we improved our work without pointing fingers? This is partly an issue of science communication and very much an issue of our deficient error culture in politics, medicine, science, and healthcare. We need to change our error culture. And by explaining how science learns from trial and error, how we often learn as much from our mistakes as from planned procedures, and how learning from our mistakes enables us to change for the better, science communicators can play a vital part. So I invite every one of you to further discuss how we can help improve our error culture. Thank you.
Thanks so much, Miriam. Really insightful. I'm going to have one question per different representative, and I'm going to ask you if you could just respond quickly. I'm sorry, we're running out of time for this important portion. I'm going to go to Charles first. Charles, how can we increase the sense of responsibility among researchers to better communicate their work in the future?
Yeah, I think it's a good question, and I think a lot has to do with the sort of the incentives involved in how we teach scientists and researchers to be scientists and researchers. And there's sort of on the academic track, there's what's within your discipline, but there's a whole another world of being sort of a scientific citizen. What is your sort of responsibility to the wider society within your research? And that comes from also changing the way sometimes disciplines are done, sort of not just sort of focus more on the researcher thinking up the question and looking into what the answers are, but sort of getting that sort of input of what the question is from the outside communities. So I think things like that should be able to reframe the way we think about science and communication.
Okay, thank you so much. I'm going to go to Mohammed next. Mohammed, we talk about communicating uncertainty. We're usually giving advice to those who have to communicate. Usually it's public health experts that need to speak with the media and so on. But what's your perspective on what the media can do maybe better next time to explain uncertainties with an evolving science body?
Yeah, actually, this is one of the most discussed questions usually. Yeah, I would say a big part of it is how we, as science journalists and media, should put everything in its context. And also we should emphasize that science is a process. It's not like rather than an end result. And we should highlight at any moment what we know, what we don't know, and that what we will know soon, that it's a kind of ongoing investigation to answer this question. So I think putting like this kind of information into context is very important, rather than just communicate the fact or the results. Put it into context and elaborate that is ongoing.
Okay, thanks, Mohammed. And I'm going to ask a question to both Miriam and Francesca together. So with the overwhelming amount of scientific information that came out, it's a difficult thing for healthcare professionals and for decision makers to absorb all of that information. So what do you think that we could do better coming from an organization that needs to communicate science to make it easier for healthcare workers and for decision makers to better digest what could be very, very complex and, as we indicated, changing science?
And perhaps I can chime in first. I think from a healthcare perspective, if we can consolidate information and make it into really bite-sized formats, that would be really helpful for healthcare workers. As you know, we're quite a fast-paced industry and we're constantly learning. So having any information that we can quickly grab to hand and learn from would be so useful.
And Miriam?
Yes, maybe I can give an example to exactly that, where from the Robert Koch Institute, the vaccination communicators, they came up with an app, a vaccination app, that basically sent push messages to healthcare workers and physicians, so that they would always have the kind of latest updates on the emerging and also administered vaccinations. And I think that was very well received, to have these exactly bite-sized pieces of information really sent to their phone. And so they didn't even have to actively look for them. And I think the other area is that, I mean, we've all been talking about COVID for 18 months. And so it's one topic for 18 months. And then, of course, sometimes there's actually nothing new. There's not really any news, but then news are created. And maybe trends and topics are almost created as the next big thing. And so I think also just a kind of a guidance of what topics to even care about or even look out for, and what to maybe ignore until, I don't know, something really clear emerges. I think that would also help professionals sort through that information.
Okay. Thank you so much, Miriam. Well, I really want to thank this panel. You've taken not just the time today, but the time throughout this past 3 weeks to really get into more in-depth discussions with your fellow experts around the world. And then thank you for sharing a summary of those insights today. So thank you, Charles, Mohammed, Francesca, and Miriam, for sharing your time and your insights. Much appreciated. So with closing remarks, I'm going to turn it over to one of my colleagues here at the World Health Organization, Dr. Ramona Ludolf will be sharing her insights. Ramona is she's the technical officer for the science translation team as part of the Department of Global Infectious Hazards Preparedness here at the WHO. Ramona?
Thank you so much, Mindy. And thanks to all of you. This conference has really received overwhelming public interest, and we've seen that science communication is a key tool to fight this pandemic and also future health emergencies. And we saw that we have a responsibility to help people to base their decisions on the best available evidence to protect themselves, their communities, and families. And as everybody has become a science communicator in the past year, we need to ensure that science becomes more relevant, accessible, and understandable to all. And to achieve this, we need to think out of the box. We need to be creative. And as we've seen, we can be creative in communicating science, for example, by using innovative technologies, by using illustrations, music, storytelling techniques, or through serious games. From the discussions throughout the conference, we've learned that effective science communication requires us to listen to our audiences, to understand their concerns, values, and beliefs. We need to meet people where they are, to not add to the infodemic and information overload, but to provide meaningful and tailored support. Effective science communication also requires us to rethink existing scientific processes, to ensure research is being shared in a timely manner, but still undergoes the necessary quality control and scientific debate. And we need to make sure that people understand how scientific evidence is built and assessed. So as Dr. Mike said, we need to be able to trust the process. WHO is committed to translate the insights gained over the past 3 weeks into action. We want to do a better job in translating science now and be prepared when the next health emergency hits. So the next steps towards this goal are for us to build a global platform for exchange by maintaining and expanding the network of science communicators from all around the world convened for this conference. A continuous dialogue with researchers, media representatives, decision makers, and professionals working in health, education, culture, and tourism will help us to identify and address challenges in a concerted and collaborative manner. We need to develop capacity building resources for science communicators, and especially also journalists, to empower them to judge the quality and independence of scientific research and share this with their audiences. We aim for strengthening scientific and health literacy among the public to empower them to ask critical questions about the information they encounter on and offline and make evidence-informed decisions for their health. And we aim to analyze existing good practice examples of science communication to understand what works and what does not work, so that we can develop more effective and innovative science communication concepts for the future. And with this, I would like to thank our brilliant keynote speakers of today, our experts from the conference who so freely and openly shared with us their expertise and experiences, and the whole team at the WHO that made this conference possible. And especially our director, Sylvie Briand, our unit head, Tim Nguyen, Mindy Frost for moderating this session, Catherine Sheridan, Jean-Frank Blue, and especially Judith Fernholten, who was instrumental in organizing this conference. We thank you for your interest and participation in this conference, and we hope that we can all work together to further build trust in science in the future. Thank you.